Welcome to another episode of the Two Idiots Podcast. I'm Reg.
I'm Randy.
And this week, we're doing something a little bit different. We have multiple guests.
It's a clip show, everybody.
It is, yeah. So basically, the point of this episode, if you haven't figured it out already by seeing our social media or whatever, is to try and get the feeling, get the impact that COVID has had locally, because in southern Manitoba, we have been slammed. We are currently, I believe, like the most deadly COVID
I think we're still number one in the country per capita, and I think Steinbach is still trending as the top city amongst that.
Yeah. So we put together, we reached out to several healthcare professionals, some politicians, some people on the ground, some local people impacted by COVID, and more specifically the southern area of the province, but not just that. Speaking of which, a boy under 10 died of COVID yesterday.
Yes, very sad.
So I think it's important for us to do this because, especially living in a community where the positivity is so high and where people are being impacted left, right, and center, I feel like we're obligated to try and spread the message that people are working insanely hard, dealing with incredibly taxing situations, and the number of people that are sitting at home safely, throwing stones and claiming it's all a hoax and all bullshit, frankly, doesn't jive with us. So
it's been really bugging me lately, especially just how many people are laughing it off and saying, "Oh, well, the people working at the hospitals are bullshitting, and it's not that bad." And it just frustrates me because these people are putting their lives on the line if they have chronic illnesses themselves or or whatever, right? I mean, we've seen that this can pretty much take anybody if it wants. So, I mean, to just blatantly disrespect the healthcare professionals and the people on the front lines, like it just doesn't sit right with me.
No, I agree. And so, personally, two friends of mine have actually had, I think, a grandma and a great grandma pass away from COVID.
Yeah, we had a family friend whose grandmother and mother passed away.
Yeah, all recently. And a classmate of mine, he's 20 years old. This one should kind of peg or sort of hit people in a certain way. He's only 20, so he's not in the highest risk zone. But he's 20 years old, got COVID. He was out of school for 3 weeks-ish, maybe a little bit longer. Probably, longer than that. But when he came back, he was saying, you could hear it in his voice. He was really like gravelly and he basically said it feels like there's sandpaper in his lungs from COVID, and
really,
because he has scarring in his lungs, which obviously he didn't have before.
Right.
So that highlights to me how important it is, because I'm 10 years older than the guy. I'm not that healthy, and frankly, if a 20-year-old relatively healthy person can get scarring just out of the blue, then imagine what could happen to anyone older or anybody.
Right. I mean, I'm walking around with, I have asthma. I have a chronic lung disease. So it scares me to go out and, catch this and potentially have it a lot worse than maybe a lot of healthy people, right? So it's
exactly
hearing stuff like that definitely hits close to home for sure.
Yeah. And another friend of mine, slightly older than both of us, but he also has asthma. He got COVID. I asked him whether the Rona was triggering his asthma at all, and he said only when the coughing gets really gnarly. So that's another thing that, as it goes, it can cause something pretty severe. So I don't know. So we, long story short, so we kind of wanted to kind of try and move the needle and have a conversation and hear from people dealing with it daily, because Randy and I aren't.
No.
So
I mean, we could stay as sheltered as we want to from it. Frankly, we don't have to watch the news. We don't have to read the reports.
yeah,
But these people have to know every day what they're going into and deal with, positive patients, and it's crazy.
for sure. And full disclosure, we reached out to Mr. Cameron Friesen, our provincial medical, whatever, cabinet minister, whatever his name is, or whatever his title is. He declined to join us, which, frankly, like I've mentioned later in the episode, I'm surprised anybody says yes to join us. So yeah. I'm not trying to throw shade. I'm just saying that, full disclosure, we reached out to the current provincial powers that be and didn't hear back. But coming up this episode, we have several interesting people to hear from. We have some frontline healthcare workers. We got a paramedic. We have Wab Canoe, Mr. Dougal Lamont. We have Dr. Devinder Singh, the Southern Health Regional Medical Officer, who's a past guest on the show. No big deal. So we hope that you enjoy it. Well, I don't know if enjoy it. We hope that you get something from it.
Take it in, really maybe sit with it and just sort of, feel for what these people are going through.
For sure. And all that said, it's important to acknowledge that people are struggling with lockdowns and with mental health and with COVID, and or even if they don't have COVID, with the unintended consequences of all of this.
Yes.
I empathize and I get it, but we just need to handle it. And frankly, the supports offered to those people that were struggling with mental health weren't good enough to begin with. But that's a separate thing, in my opinion. Anyway, so without further ado, let's dive into it here. So a healthcare professional reached out to us, and what did she say, Randy?
Well, Red, she wrote us a nice little letter here. So I'm just going to read it out, and we'll see what she has to say. So she titled it "Impact of COVID." I work in Winnipeg at one of the hospitals with an outbreak. The first few months weren't too bad, and the biggest change was having to wear a mask at work and not having any visitors. But the public health rallied, donated headbands with buttons, sent food, and then visitors were once again allowed. Then COVID hit us for real a couple months ago. We had an outbreak, and some of my coworkers got sick. Some of them are still sick and struggling. Even if you survive, it's still an awful illness to have. One of my coworkers has been off for over a month with residual effects, and she is a healthy young person with no other health issues. With so many of the staff off, that puts pressure on the rest of us to work overtime. If you're a nurse, you get mandated to stay for 16 hours and then have to do it over again the next day, maybe even for every day you work that week. I don't work in a COVID unit or ICU, but I know that things are dire there. I have friends who do work in ICU, and they're working constantly with nonstop overtime. Some overtime is voluntary, but a lot is mandatory. The ICU is full, so they've had to convert other areas to accommodate ICU patients, and there aren't enough nurses to staff them all. On my own unit, we've had to make constant changes. Surgeries have been canceled, so we take other types of patients. It's hard because we are trained for specific things and have to learn how to take care of these other patients on the fly. On top of all that, we're afraid of getting sick. We see firsthand what COVID does to people, and it's scary to know what can happen to us. I've had bouts of anxiety before my shifts, knowing I'm heading into a hot spot. I see comments on Facebook about not wanting to wear a mask or this being some kind of way the government controls us, as if every level of government in so many countries has suddenly agreed on this one thing, and I'm saddened. They simply do not believe that what healthcare workers have to say, yet we have to treat them as they come in. It's both saddening and infuriating.
Yeah, that's pretty succinct. Sums it up pretty well.
For sure.
Yeah. So our hearts go out to those dealing with this on the front lines, and not just, healthcare people. We have we'll be having later on in the episode a retail worker as well, because that's another part of this, right? Like to speak Absolutely. On mental health and people dealing with people during a pandemic.
In terms of sheer potential contact volume, they're right behind healthcare workers as seeing hundreds of people a day. So
exactly. So again, that's one testimonial. Coming up, we will have Mr. Josh Ryan to tell us the paramedic perspective.
I do quickly want to make one point that I think she got across. I'd like people to know is that just because you don't pass away from this thing doesn't mean that there might not be long-term effects, as you alluded to with your buddy at school with his, the scarring in the lung tissue, and that just because people aren't dying, the hospitals are filling up because people are getting sick, staying sick for 3 weeks, a month, up to 3 months at a time. So that's why our system is becoming overrun. It's not just that people are coming in, getting it and passing away. It's that they're getting it and they're having really bad effects. They're keeping them in there much longer.
Yeah, for sure. And there are people still in ICU and critical care that they're not being counted in the general numbers because they're not considered, quote, infectious, but they still have or had COVID, or they're dealing with the symptoms after getting the disease. So it's easy to look at numbers just as black and white, as saying, this number of people have it or don't have it, have recovered, have died, have moving on, and treat them as numbers. But each number is a human, is someone that lives in our community, is someone's grandma, grandpa, aunt, uncle, sister, whatever, son. It's a family member, it's a person, and it's someone that we should care about. And I think it's important to say that we're not discrediting or discounting the impact of other things while this is going on.
Absolutely.
There's plenty of heinous things in the world, poverty and hunger and, child abuse and et cetera, et cetera, et cetera, et cetera, that are still important things. And I hope that as a society we can get to dealing with those things. But this is the one that's affecting us the most right this second, that we just need to deal with, I think.
The biggest thing, we have to try to get on the same page. I know a lot of people don't believe in it, think it's a crock and whatever, but if everybody just put all that aside for a little while, got on the same page, we all start wearing our masks, doing what we can. I don't want to see lockdowns either. I don't want to see small businesses have to close and for people to lose their jobs and lose their livelihoods. But if more people would start jumping on the mask train and just being, hey, you know what, I'm going to suck it up for a few more months, potentially a year, whatever it's got to be. I'm just going to suck it up. We're going to get through it. We'll look at rebuilding as soon as this is over.
100%. So on that note, let's move forward here with our chat with Josh Ryan. All right, we're joined now by Mr. Josh Ryan, a paramedic in southern Manitoba, to kind of join our COVID episode here. So welcome back to the show.
What's up, boys? Hey, how you doing?
Good. So far.
Good.
Josh was previously on the Two Dates podcast, I don't know, 30 weeks ago or 40 weeks ago or something, long time ago.
That's specific.
It's not that specific. But anyway, so we touched on his general paramedic life. And since then, a global pandemic has happened. So we wanted to kind of get your perspective on that from your job. We're talking to other people kind of in healthcare.
But, what's changed for you specifically in terms of what you do?
Basically everything. Yeah.
Really?
It's I could get more specific. It's a drag. The whole thing is a drag.
Yeah. Yeah, we can relate. Yeah.
What would you, I guess, what specifically would you like to know has changed?
Well, what?
I guess maybe even just your daily routine, right? Because I'm sure you had a routine set the way it was. You get to work, you do the truck, you do all that, and then now, what's different? Even just from your first hour getting to work to picking up a patient and doing whatever.
For sure. So everything around even the station has changed. We're wearing masks in the station all the time, and there's physical distancing, of course, just like any other workplace. Well, it should be happening in every other. And now we have these PPE bags in the trucks that we have to check every day. That has all of our gowns and face shields and all sorts of stuff. So it's a lot more lists to keep up with. Just kind of checking to make sure that we have all the things that we need. And then every call is just a whole nother world. It wasn't so bad initially, because Manitoba kind of skirted through unscathed, it seemed, for the most part, early on, right? And it's just been the second wave, or whatever they want to call it, has been particularly unpleasant.
Yeah. Are you guys running pretty ragged? like more calls or just severity?
Yeah,
of
in
calls,
the last month or so, it's been pretty intense. The area that I work has had quite a lot of cases, and there's a large like geriatric, like elderly population. So I think that also kind of plays into it a little bit. I mean, I'm not an epidemiologist by any stretch, but that demographic seems to be harder hit, right?
Mm-hmm.
But when you have a community that is full of that age group, I guess you're going to see more cases. I don't know.
Yeah. Were you
these more serious ones for sure?
Yeah.
Were you called out to any of those personal care homes? Like recently, what was that? A couple of weeks ago, I forget which one it was in Winnipeg, where they called out 6 ambulances, and the dispatcher was like, "Well, normally we don't send out that many unless it's a big deal." So they sent out, I think, 2.
No,
and that's when they
I read that story just like everybody else. I know someone who was there.
Yeah,
and they, privately confirmed to me that everything that showed up on that Reddit post was accurate. But
wow.
But I've been to like pretty much like I don't even know. They should probably have a list of like personal care homes that don't have outbreaks. That would that list would be shorter, probably.
Yeah. Right.
Because there's several hospitals that have outbreaks, and most of the care homes in my area have an outbreak, right? So it doesn't mean that everyone in there is sick. It just I think their standards for changing the facility to code red or to an outbreak status is only a couple cases, right? So they want to prevent them from jumping
for sure
between clients.
Yeah, we are recording on November 29th. This morning there's a big church service going on to flout public.
Are they still doing it?
Yeah, they are.
Well, that's their plan. Yeah.
Before we recorded, I saw the pastor was going live on Facebook, and it had thousands, and people are sharing blah 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 blah. And apparently, we're all communist and all this stuff. From your perspective, as someone on the front lines, I mean, you're not working in the hospital necessarily, but you're dealing with people that are sick on day to day.
Bringing people to hospitals potentially, right?
I imagine with COVID and without. How do you feel about that type of narrative that people keep trying to float?
Well, I think if we want to jump back a couple of weeks till when there was that protest thing, we'll say it was in Steinbach. I don't really I was pretty upset about it initially because it just seemed like a really big disrespectful slap in the face to people who are trying to help, because I'm picking up the 2 weeks surrounding there were particularly bad. I think I was doing multiple COVID calls a day, and I over the 2 tours of those 2 weeks, I couldn't even tell you how many COVID positive patients or probable COVID patients I was in contact with. I don't remember because it was that many,
Wow.
So I was bringing people constantly into the hospital and constantly bringing people out of the hospital to Winnipeg ICUs. Did multiple trips like that. And so you see how hard the nurses and the doctors are working, and you see how hard all the health professionals really. And it just seems so disrespectful for a group of people to just basically I don't know. I mean, we could talk about it for hours, but putting a mask on your face isn't oppression by any standard, right? And if that's our definition of oppression, we really need to open up some history books, probably.
Boom. No
so
kidding.
Anyway, to answer your question, when people are openly floating rules like that, it's frustrating because statistically someone there is probably sick, right?
Yeah.
And the nature of this virus is that it's very infectious, and it likes to be, transmitted in close spaces with a lot of people. So it's probably going to result in some people getting sick, unfortunately. And I don't. It's ignorant. I don't know what else to say about it. Right?
That's basically that we're in the same boat that we've hammered that point many times, and it's just it doesn't work to just say it is what it is, but it is what it is because we, you can only spread so much information if people don't want to listen to it.
And I mean, at the end of the day, I guess that's all you can do, right?
Yeah.
If people aren't going to listen, they're not going to listen, and clearly. This group of people isn't deterred by fines. you know?
Somehow. Yeah.
So, they're all rich.
Yeah, I guess so. I don't know. I mean,
so back to,
and I think maybe when people aren't personally affected by it, right? Maybe they don't know someone who's gotten COVID-19 and they don't know somebody who's died. Maybe it's harder for people to form a connection. Like, hey, this doesn't really affect me, right?
That's sort of what I've said too. It's until they get sick and they need help, or until grandma or grandpa dies or mom or dad, then they're just not going to get the hint.
Yeah, and I mean, I'm in a position where I see it all the time, right? So I'm in it, so to speak, right? Yeah. I mean, I have a handful of coworkers and who have gotten sick, but no one who's really gotten really, really sick. But I've seen really, really sick patients, right? I've seen people that I brought in who later died, right?
Wow.
Or people who I brought in really sick thinking they had COVID, and then I get the contact tracing call that they did in fact have COVID.
Right.
So of those people, what's the what's the general experience? Like that if they're sick, it's mostly just coughing, or kind of what are the people like when you pick them up to the hospital?
Like most of the people, I think I've, like, without giving away any personal health information or anything like that, there's been an older demographic. So I think the youngest person I've had is probably 50-ish.
Okay.
But all the way up until 80 plus. And most of the time it seems to be like the cough and the fever. The diarrhea is a super common one. Like I had one person who just had diarrhea for like a week. It's like, that sounds awful. like she they couldn't eat, couldn't drink. Like imagine that. Like that sounds terrible, right?
Everything just
so you're dehydrated and everything because of that, right?
Yeah.
So the cough, like fever, chills, like crazy temperatures on a lot of people, like really high temperatures. Some confusion if it like mixes with other comorbidities, that kind of stuff. But yeah, basically all of those symptoms that you read on the government website, I've seen all of them in some combination for sure.
Right.
How are you handling the stress of it?
I'm doing okay now. I've got a good group of people around me that I can talk to about that kind of stuff.
That's good.
My last tour of work, I didn't work a full tour. I had a couple days off, so that was nice. So it wasn't like 4 days straight of being hammered. But it is kind of an interesting, place to be, sitting across from a patient who is super, super sick, and you're hiding behind your wall of PPE, just hoping that you don't have a breach somewhere, that you're going to get sick. And that's definitely super stressful, right? Because everything about transporting or being with a COVID positive patient is there's just so much more work involved. Like, you have to wear all of this PPE, and it's very difficult to communicate, especially through the respirators that we wear. We sound like, Bane from Batman. It's all muffled. Kids think we're crazy. Like, they think that we look like robots. I don't know. They're scared of us. So it's difficult to communicate. You're hot. You're uncomfortable. You're trying to help a sick person. After you finally offload them, your ambulance is just filthy, right? You need to wipe down everything, and then you can start your paperwork. So everything just takes a lot longer, and you got to be careful about what you touch. So you're keeping this mental note in your head, trying not to cross-contaminate things.
For sure.
Right.
And I don't know, it's a lot of work for sure.
Well, absolutely. No, for sure. That's So I mean, even from your perspective, again, the point of this episode was to kind of try and show it. I mean, whether anybody listens to it or not, we'll see. But for the people that are either pushing against the orders or saying it's a hoax or saying it's overblown, the point is to try and get these real life local people that that are dealing with it, and just to try and get over that barrier. So I'll ask you: do you think the media has overblown it? Do you think they're underreporting? Do you think how do you feel about how it's being portrayed in the media?
Yeah, the media is a tricky one. I mean, has the media overblown it? Maybe. I probably not. I mean, how do I answer that?
Well, it's tough to say for sure.
I mean, they're reporting on what the numbers the government is putting out, right?
Yeah.
And then of course, you know, it seems like some of the news agencies are in disagreement with the government or whatever. But the fact of the matter is, the numbers are the numbers.
Yeah.
And the amount of people that are currently sick, like, there's no way that's not a real number, right?
Mm-hmm.
So, I mean, I'm not an expert on how media, influences public opinion.
Sure.
But it's interesting, though. I was doing some reading about previous epidemics, right? Or pandemics, like SARS and MERS
H1N1,
and all of those.
right.
Like, this is not the first one, right? H1N1, sure. And we didn't have the same thing happen, right? So, I mean, maybe there's an element of media and social media here at play. There must be, right? Yeah. Causing people to just not believe in something. Like, it's science. I don't know. I have a hard time wrapping my head around why someone wouldn't think this is legitimate, because
right.
I'm not a scientist, but I believe in science. Like, I understand science, and I get it. It's just, yeah. I don't think
it seemed to. That's always it seemed to bother me the most. Is it's like nobody wants to just, like, we used to believe the scientists and believe the doctors, and now for some reason we think that they don't have our best interest in mind. I don't really understand it.
Yeah. Well, everyone's an expert, right? I mean, you talk to your friends and they're like, well, the positivity rate was 13.2% today, right? And there's a backlog of cases. Like, everyone's become, including everyone's become an expert on COVID-19 cases and positivity rates and where it's worse and where it's better. It's funny, right? That's the only thing we want to talk about, and it sucks.
Yeah.
It really does.
Yeah.
Right? But I think it's easy to forget that people are dying.
Yeah.
Like across Canada. I don't know what the daily death toll is, but hundreds of people a day who otherwise wouldn't have died are now not with us. And I think when you just see everything in tallies and numbers, it's just easy to detach from it.
Yeah.
Right.
Yeah.
So. Yeah, that's what I said. I was talking to a coworker about the other day, and I said, look, like, I know you can't release the names of these people, but say you could for whatever reason, right? Then the people seeing it can start to see, okay, this was, John blank, whatever his name was, right? So that was a grandparent and that was a father, rather than just seeing the numbers, because it does kind of dehumanize it a little bit.
Yeah, for sure. For sure.
Yeah.
But,
I don't know. It's
real. It's happening. Yeah. Whether people want to admit it or not, it's happening.
Yeah. Yeah, I don't know. It's I just don't know how we go where we go from here, because unless everybody takes it seriously, and then we get into the point of anti-vaxxing, and once that becomes available, then people will say, then they'll have all their stories for why they don't want to do that, and blah 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 blah.
Yeah, we're like our own worst enemy in a way, probably.
Humans kind of are. Yeah.
Humans. Good for us.
We're something. So you also have a young son. How's he dealing with everything as far as schooling goes, and especially with the dad in the situation that you're in?
He's doing okay. It's funny because he goes between his mom's house and my house, and obviously I'm in a higher risk job. Like I feel like for the most part I'm protected. I mean, there's been stories out there where people don't have come forward with issues with PPE and stuff, and fortunately that's not my experience. I feel like for the most part we've had adequate PPE.
That's good.
For our job. But even with all of that, I mean, there definitely is a chance, just based on volume, that I could get sick, right? And that's
for sure.
That's something that I pretty much think about all the time, right? Because I don't want to get him sick. I don't want to get his mom sick. I don't want to get the kids that he goes to school with sick. I don't want to get my partner sick. Like, it's just, you're constantly, like, you wake up in the morning and you got a bit of a tickle. You're like, is it just dry air, or right? I don't know. You get all paranoid.
Yeah.
Anyway, to answer your question though, he's doing pretty good. We had him out of school for a few weeks. We recently just put him back in, and he's happy to be with his friends. But I don't know, kids are resilient. He calls it the sickness. you know. Yeah. Well, we can't go to the store because of the sickness. Yeah, because of the sickness. Exactly. So
I love it.
I mean, you kind of tailor it. Randy, you've got kids, right? You kind of tailor it there.
Yeah, she's basically almost 1.5. So for her, like, it's.
She doesn't understand.
But what I'm interested to see is, like, now, because she's in daycare every day, like, her basically just seeing adults all the time with face masks, right? And so that might become like a normal thing for her. So once we all start taking them off, it's gonna be like, oh, this is kind of strange.
People have mouths. Weird.
Yeah, exactly.
Remember at the beginning of the year, his teacher had one of those masks that had like the clear little plastic, so you could see her mouth. Creepiest thing.
That's weird.
I can't look at this lady in the face, like in the eye. That's weird.
That happened. That sort of happened to me, actually. I was in my evening adult ed class or whatever, and I'd been wearing a mask. Obviously, everybody has been, and I took off my mask. This was a couple of weeks in already, and to take a sip of coffee or whatever, and a classmate of mine was like, "Oh, you have a beard," and then she just starts laughing. Just didn't even occur to her.
Right? That brings up a really interesting point. I mean, everybody now is hiding behind these masks, but in healthcare specifically, like we can't take them off at all, right?
Mm-hmm.
We can't. I mean, when you're dealing with someone who isn't a COVID patient in the hospitals, they'll most likely just be wearing a surgical mask. We're wearing you may have seen them on the news, but they're like N95 half respirators.
Oh yeah, sure.
So they look like a mask, and they've got these cartridges on the side. So we wear that for every patient contact, COVID or not. Makes it hard to communicate, but it also, like, you can't read people's faces, right? Yeah. I don't know. That was the thing that I kind of struck me when initially it all started. I'm wearing this big respirator, and someone can't see my mouth, can't read my face. It kind of takes a little humanity out of medicine, almost, in a way, right? Because like, I don't know what fraction it is that we communicate with our facial expressions, but I think it's up there, right? Yeah. And now you're taking half of that away, right? And all I've got is my eyeballs, and I'm trying to, like, it's hard to convey, like, sincerity and empathy
and sympathy,
and sympathy, all of those, very human traits that people who are sick need from their healthcare providers and other humans. It's hard to convey those things when your face is half covered. Makes it tricky, makes the dynamic a little bit challenging, for sure.
I believe that.
Yeah.
Okay, so we're coming up on couple 20 something minutes here. So, I guess broadly speaking, you guys have been busy, but you're stocked up. But stay safe out there. I mean, what else can we say?
Yeah. We'll do our best, for sure.
Yeah. Thanks for joining us, though. Get a little window into your side of the pandemic, I guess.
For sure.
Well, thanks for having me.
Yeah, for sure. Always welcome. And maybe
great.
Once the pandemic's gone again, we'll have you back on just for fun.
Oh,
there
yeah,
you go.
Sure. We could talk about Nintendo or I don't know.
Fun things.
I'm learning to play the bass guitar. Does that count as something?
Well, there we go.
I'm not very good, though.
You can redo our intro with the bass guitar.
Yeah, there we go. Okay, so send me the tabs. I'll try and figure it out.
Well, I don't even know how to do that. But anyway, let's. Thanks again, Josh. Again, hope the best for you and everybody involved. Your coworkers. Thank you for doing what you do, as we thanked you previously. But we need people like you to bring people to hospitals and get a handle on this. So thank you.
Right on.
Absolutely. Thanks.
All right, man. Have a good day.
Take care.
Bye.
Bye.
And we're back. So, joining us now after Josh's testimony, there are his experiences. So, thanks again for joining us, Josh. Coming up now, we have a friend of mine that's working in retail and has been every day pretty much since COVID happened. So, it's not healthcare, but it's still an important perspective. And here he is. All right. So we're joined now by an anonymous guest, a John Doe retail worker, we'll call that, who has been working throughout the pandemic. We don't need to specify on, I guess, what the business is or whatever you want to talk about. But welcome here. Thanks for joining us.
Welcome.
Thank you. It's great to be here.
Yeah, I mean, we should have had you on sooner. But anyway, this is the situation. So we, as we've mentioned in other interviews, the goal of this episode is to show how people are being affected on the front lines day to day, dealing with COVID and the different types of things. We've had some healthcare people, so this will be the retail side, I suppose. So tell us, how's it been? How's your life these days?
It's bullshit. I mean, to put it in the nicest, easiest terms possible, it is fucking bullshit. I don't know. I can add a little bit of rainbows in there. It's good and it's bullshit. Like,
that's fair. Okay.
Yeah. Have you found that it's gotten more bullshit since the more intense lockdown has happened as opposed to earlier?
It comes and goes in waves. So I find, the first kind of round, people were antsy, and I mean, they had every right to be. And then, we hit summer and, we got that taste of normalcy again, right? Like, I think everybody can say that, looking back, what is it, 4 months ago to now, it's a complete, we're back into March.
Yeah.
And so, yeah, we're back riding that shitstorm wave of people that are inconsiderate to retail workers.
Yeah. And especially, I mean, I think it would probably be helpful to clarify that technically you work for a place that I guess is deemed essential, but in many ways is not. I don't know if that's unfair to say.
No, I think that is quite fair. I mean, I think there's a small portion of our business that could be deemed essential. And I mean, to certain people, for sure, it could be essential for what they're needing. But to the vast majority of people that I see coming through the building that are just browsing, it's not essential. Sure.
Right. So then what about it seems bullshit to you? Like why do you have that feeling?
Again, it's the browsing. It's we're a business that we allow that that's kind of how we ran before COVID. It was about browsing. It was about hands-on kind of approach to retail, and I mean that worked for us. And then COVID happened, and now is not a time to browse. If you need us, we are there, and we are more than happy to help you. But browsing's not a good thing. Browsing puts all of our lives at risk, to put it mildly. I mean, it might be an over-exaggeration to some, but to me, it's not. There's a lot of, I have underlying health conditions. I have to work. I have to pay my mortgage. I work retail and I own my own home. I can't sit at home. I don't have that option. So
sure. So then,
have you found a lot of ignorance with the general public lately?
It's bad. I mean, to put it mildly, I can probably name, maybe 5 customers a day that say thank you or treat me as a person, as a human being, versus the amount of people that don't care and it's all about them, and they don't care about anybody else. So
have you had any mask mandate issues? Like with recently, we saw going around that guy that kicked the piss out of some Walmart worker for trying to enforce masks.
I just saw that. Yeah, I just saw that. One of the other people on the leadership team shared that with me, and I watched that just before coming on with you guys, and I mean, I don't even know. I don't have words to that. Like what the fuck?
Yeah,
like,
right?
Come on.
Yeah.
It's a fucking piece of cloth. Sorry not to go into that tangent. To go back to your question, surprisingly, no. Are we seeing certain people? For sure, yes. But I think the big one is somebody just being able to wear a mask properly, and the idea of wearing a mask properly is covering your nose and your mouth. That's proper mask etiquette. Come on. But for the most part, when we first got our mask mandate in Manitoba, I was shocked. People actually wore it.
Yeah. I mean, I was a bit too, mostly, but in Winnipeg, it didn't seem to be as big of an issue, but being from Steinbach as we are, especially now, like recently there's been a ton of resistance, and it sucks, and I hate seeing it. It's getting worse and worse, and unfortunately, the more restrictions they put, the more people are saying it's bullshit and it's unfair, and I get that on some level, but it seemed like Winnipeg definitely took it easier than Steinbach so far is. I guess speaking of restrictions, how do you feel about them in general? Because you work for a place that isn't a small business. Do you think that these rules are fair? What are your thoughts on these types of restrictions?
I think these rules are 100% needed. I think they are 100% fair. You need to look at it as this isn't an infringement on your rights.
Mm-hmm.
You don't have a right to go to a retail. I mean, you do have a right to go to a retail place, but at the end of the day, this is about protecting people's lives, and I think that's what's being overlooked here. Is everybody's saying, well, this is infringing on my rights. I have a right to go out in public and do whatever, but there's a little bit more to this here. There's get out of your head and get out of your world that you're in and think about the greater good that's
For
right
sure.
in front of you. Think about your neighbors. Think about whoever, but you could be saving their lives by staying at home.
100%.
For sure. We've hit that point made before on the show where and it'll be coming up in this episode actually, where your quote unquote right to not wear a mask is now infringing on somebody's right to live. So where does that line get drawn, right? Like you can't have it one way and then have your cake and eat it too, kind of thing.
Oh, for sure.
Well, and I mean too, this is coming from a guy that as I said before, I depend on people coming in and spending money. This isn't coming from somebody working at home. I need people to continue coming into my business so that I have a job after all this is said and done. But at the same time, I would like to live. If if I were to get sick with this, I want to be able to continue paying that mortgage and stuff. So I mean, this isn't coming from just a place of resentment of all this. I want to be able to help people, but at the same time, stay the fuck home.
And that's the tricky line that we're kind of having to walk, right? Like we had again on this episode, we will and have had conversations with people kind of making those decisions, or they're kind of influencing those decisions, and kind of where do you draw that line? Like it's either you shut this down and this person might be affected negatively, but you might then reduce the spread by X, blah, 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 blah. Right? So how do you deal with that? Do you think that your business has been doing the most that they can, and kind of how's your day-to-day changed compared to what it was?
So I'm actually happy you asked that. In terms of my business, they have done the utmost to protect not only the customers that come through the building, but also the staff. And to that, I am forever grateful. But they can't do everything. If you're sick, stay home. We had our first COVID positive case in the store.
Oh, wow.
And that started off with a customer. Now again, did the spread happen, with this other person? That's said to be seen. I mean, contract tracing in Manitoba is, subpar at best. But I mean, we had our first COVID positive employee in the store, and that's super scary. That is a very scary moment to hear that.
I was going to ask whether you had any positives floating around or anything like that. So you also mentioned to me, so you mentioned to me that you wrote an anonymous open letter to several provincial leaders regarding COVID. Maybe touch on what that letter contained, kind of what the response has been like, and go from there.
Yeah. So, I mean, I don't have the letter right in front of me, but it was basically before this lockdown happened. And I mean, our numbers were rising, and I mean, the writing was on the wall here. And, I do listen to Brent Ruson's daily updates, and every single day, all I heard him say was, stay home, stay safe, stay home. Don't go out unless absolutely necessary. But at the same time, nothing was being done to force people to stay home. I've seen it from the beginning. The message hasn't changed since March, which is to stay home. Basically, it's not like at any point in time when we were opening up, he said, "Okay, well, jump out there, run, see your family and friends." Sure, we definitely, lifted some of the restrictions that we had put in, and maybe that was jumping too far in, but yeah, my letter was just basically saying, hey, we need to rein this in. These major corporations that are out there are skirting around what is actually essential to live, right? Like, you need to look at it as, what do you need to live? You need food to live. You need water to live. Do you need, and I mean, some circumstances you need clothes to live, but do you need that big flat screen TV to live? Probably not. I mean, I think, basic kind of thing.
I mean, I do,
but then, sorry, in terms of response, I wish I could say I had a better response to this. I emailed all of the provincial leaders, Mayor Bowman, all of my local MLAs, that kind of stuff, and I got a response from Mayor Bowman's secretary. Which, did he hear about it? Probably not. But I did get a response from one of the provincial leaders, which, I mean, still shocks me. But Wab Canoe responded to me and actually emailed me back. I sent that out probably midnight on Monday, and he responded at 8 a.m. on Tuesday, 8:30 or something like that.
That's fantastic.
Yeah, he's pretty great. Yeah. To date, he's officially our most frequent guest.
A 3-time member of the Two Idiots Club.
Yeah.
Well, it's not enough. You got to get him on more.
We were joked about that. Yeah. No, I commend you for doing kind of the civic duty of reaching out to your representatives to try and get some movement. And who knows, maybe it was your letter that started the slide and kind of moved the needle.
I mean, I'm going to take credit for it. I mean, I was at work watching the next day after this, and Brent Rusin started to talk about, retail, and, just because it's open doesn't mean you should go shop there, and yada, yada, yada. And I mean, whether it was me or apparently he'd received a bunch of messages, I don't know. But I mean, a small part of me was like, yes,
yeah,
me. Screw you guys.
At least you were part of that. Yeah, I didn't send any messages to anyone. I've had some conversations with Wab about kind of why the government was so hesitant on mask mandates, and kind of when they were randomly making certain places you were supposed to wear it, and then other it was just it was all wishy-washy. But otherwise, I don't tend to chat with my local representatives because, frankly, they don't represent me in most cases.
And in all honesty, I had never in my life sent an email. I mean, even to one of my higher up bosses, I never emailed them. Never mind provincial leaders and that kind of stuff. I'd never done that before. It was uncharted territory. But I'm so determined, and that message needs to get out there to stay home. Like, stay home, guys.
Yeah.
I can't say that enough.
Exactly. And
well, that's just it. I mean, there's no more coming to work with the sniffles anymore, right? Like, there's no sense in even taking the chance with it.
Yeah.
No, and that's another thing. I mean, sick calls have gone through the roof, and that's good, right? It's the new normal. No more, well, I just have a cough, I'll go in, it's fine. It's, you have the sniffles, you stay home, and that short staffs us a lot.
Mm-hmm.
Far more than I wish to admit, but it screws everybody over, and then in turn that angers customers, because they're there to get now their essential items or curbside pickup or whatever it might be, and we can't provide that same service that we may have had a year ago, and that frustrates people. And I get it, but you got to have more of an understanding here, guys.
Patience is a virtue.
Yeah, that's what they say.
I wish more Manitobans had it. I really do.
More to that, what's you have any horror stories that stand out to you, or people that have been aggressively awful?
I mean, I can't give specifics because it happens every day. And I mean, I wish I could say otherwise, that I didn't get sworn at 5 times today, and I mean, that's just a number. I probably got sworn at more. I was saying right before, we have I won't give too much information because it might give it away, but we have a service that we provide for curbside, and this person was waiting 20 minutes, which, I mean, sure is a long wait, right? I'm not gonna say that it's not, but when you looked at our parking lot and you looked up our lineup outside for curbside pickup, 20 minutes was pretty good, and there's people waiting more, and they texted into us, hurry the fuck up. And it's like, really? So we texted back saying, thank you for your patience. We really appreciate your understanding during this difficult time.
And you just know that set them off even more. You just know it.
Here's the thing with me. I kill people with kindness, but if you know who I am, I give those little underhanded jabs that's like, to me, oh yeah, it's good. But to most people, they may not understand that. I've been spit at.
Really?
I think twice. Oh yeah. First time was in March when we didn't let a guy in and he spit at my foot. The next time was more recent. This would have been in probably September. A guy actually spit more at my head versus the other guy was spitting at my foot. And whether the guy with the foot was intended or not, I don't know. But the face thing, that was 100% intended, and that's assault.
For sure.
That's some scary shit. I've had people almost want to fight me before. I've had people ball their fists at me, and I'm sitting there looking like, okay, am I about to get into a fist fight over nothing? Basically, like, what the fuck, guys?
Yeah. Wow. That's with this again. We can empathize and sympathize in the fact that people are stressed out and at their wits' end and things are not going great for a lot of people. But there's still people on the other side, whether it's a grocery store or a hardware store or any store that you need to go to. The people working there, they're dealing with this shit. So because Randy and I, we don't work in any sort of sales thing, but so we're always on the outside of that plexiglass. And if we're annoyed by it, imagine being the person that has to wipe down that stupid pin pad 10,000 times a day. And then they have to, change their gloves and do all this other bullshit and move around, whatever.
Yeah.
So I get it, but we need to be a bit more understanding of the people that are going through this shit for us.
Yeah. Well, it's like the associates at like Walmart too, right? Like, they don't want to give you shit for going the wrong way down an aisle, but it is their job and they have to do it, right? Because it's what they're supposed to do. They're just doing what the bosses tell them. And I think people lose sight of that too. Is it's not that these people want to inconvenience you and waste your time, but it's the way things are. Like, I think people forget that it's like we're all in this. Like, it's not like you're the only one dealing with it.
Yeah.
No, and that's that's kind of actually one of my messages that we hear that term all the time. We're all in this together. And it's probably a term that might be overused to some, but really think about this. Every single one of us is going through this pretty much in the same way, right? Like there might be, the celebrities and stuff like that might be a little bit better off than us, but they're still dealing with the simple fact that COVID's a deadly virus and it's killing hundreds of thousands of people across the world. And it's scary and it's stressful. We need to be decent human beings to each other during this time. And the complete opposite is happening. We're more divided than ever. And I don't want to get more into the political side of things, but it blows my mind to watch the news day in and day out and to see us as a civilization go the complete opposite route of what our political leaders are trying to do and bringing us all together to fight this virus. Yeah. If we were all on the same page, we would not be in the same situation we are today. It could be a completely different world.
For sure. Yeah. It's, I read something today actually where it basically said that this virus has, how was it now? The assholes are more assholes, whereas the kind people are kinder. So basically it brings out whatever you already were. It brings it out more. It amps
you, like it amplifies it.
Yeah. So basically choose what side of that you want to be, right? So I try not to be a dick as much as I can, whether or not I succeed, right? But
it's the same with me at work. I try not to be a dick, but if you're a dick to me, I've grown up on the simple concept of treat others the way you want to be treated.
Sure.
It's plain and simple. We learned that when we were 4 years old, playing with our childhood best friends.
Yeah.
That message is simple. Treat others the way you want to be treated. If you want to be treated as a dick, sure, treat me as one. And I will give it right back to you, like you're an asshole or whatever it might be. I don't care. I will do that right back to you. But treat me with kindness. I will kill you with kindness.
For sure.
I don't want to get into the doom and gloom with everything because sure, there's some great people that have come through that have actually thanked me. I had a woman bake me cookies once. Couldn't take them because it's COVID world, but I appreciate it. I mean, thank you.
I was going to say, just dump them in the garbage right in front of her.
Well, it was a little awkward. I don't know. I don't want to say what I did with them, but it's one of those things. I mean, I get, obviously the assholes are what remain out there versus the nice people, but there are nice people out there, and I want to make sure that they are recognized as well.
For sure. I think that's a good note to end on, because in spite of all the negativity and the shit in the world, good people exist, and we all know them. And if you're listening, and you know who you are, but if you're being a bit of a dink, you also know who you are. So we hope that you'll treat your retail staff a little bit more respectfully after listening to this. Maybe it's real people there, folks. Let's realize that.
Just like you guys. Just please smile, treat us, thank us. You don't even have to thank us. Just be nice.
It's a pretty low bar to clear, frankly.
I don't need to be thanked every single time. Just come in, come out, get your shit, and leave. That's a good interaction for me.
For sure. But we will thank you, Mr. Anonymous Retail Worker, for joining the show.
Well, thank you for having me on your show. I appreciate my message just going a little bit further than what Wob might have heard or what somebody else might have read that didn't respond. For sure. And so like I said, thank you for joining us and being a part of this super random episode.
Super COVID special.
Yeah. It's like a holiday special. So thank you. Stay safe. Start fighting some people if they deserve it. Maybe that's up to you. You do you.
If you hear something in the news, it wasn't me. I promise you.
That's fair.
Plausible deniability.
Yeah, maybe after COVID's done, we'll have you back on to be you. You can be you.
For sure.
Yeah, I love it. Thanks, guys. I really appreciate this.
Sounds good, man. Like I said, stay safe. Thanks again for joining us, and have a good night.
You as well, guys. Thanks.
And yeah, we're back. So we're going to go right into another testimony that we got from a nurse working on the front lines here in southern Manitoba. So here we go. The job of a healthcare worker has been more stressful in these times for two reasons. That of COVID-19 and the workload from the unit. Some of the frustration is related to politics, many are from ignorance. Sometimes it's also just unmotivating to see the pressing concern to put blame. Many of my coworkers have dedicated tireless hours for the community and in this pandemic with sometimes feelings of no end in sight. The biggest frustration being our pleas for personal responsibility and adherence from our communities falling on deaf ears as the COVID cases climb. It's frustrating to see that there are still some people who would rather believe in fake articles and conspiracy theories when they haven't stepped foot in hospital grounds where every bed is occupied. An entire ward dedicated to COVID-positive patients is overflowing and have now gone into other wards. Critical staffing shortages are evident, and in a desperate attempt to avoid complete crisis, our managers are offering additional OT shifts to all direct care staff. Every nurse I know is working at least an additional 1 to 2 12-hour shifts a week to help our health system, and yet it's still not enough. We've been pulled to work on different units where we have no orientation or training because of the surge of patients coming in, and just not enough nurses to circulate. Every hospital is struggling, especially in Winnipeg. They added ICU beds but no staff to accommodate specialized care unit, and that is scary. Nurses show up for work and are redirected to other units with no orientation or competency to that unit. It's evident at this point, a nurse is a nurse. Morale is low, everyone is exhausted. 16-hour work shifts are more normal to us now, just to be able to help out the way we can. Despite the new norm of chaos, we try to pull it together because that's just what we do. Amidst the chaos, I'm grateful for my supportive coworkers who uplift me despite feeling overburdened by what we see. I'm also grateful for our community's response of encouragement and support. As distressing as the situation can be, we still try to look at things with a positive mindset. It's been a crazy year, but we're taking it one day at a time. So, that's a great perspective, both highlighting the difficulty or the difficulties that are being faced by our heroic frontline staff, while also acknowledging that there are people out there that are supportive and helping. But I think it definitely helps to hammer home the point that the staff are getting overwhelmed. We need to take this seriously. Yeah, so we're going to continue on here now with kind of more the official, more 10,000 feet above perspectives. We have upcoming Dr. Devinder Singh, the Regional Health Officer, coming up, followed by Mr. Wabanakwit Kanu, the NDP, or the Manitoba NDP leader. And after him, we'll have Douglas Lamont, the Liberal leader. So basically, the goal for that was to get more of the government perspective and kind of what they think of everything going on. So we hope you enjoy, and we'll be back after them. We are joined now for the second time on the show in general, but today by Dr. Devinder Singh, the Southern Health Regional Medical Officer. Did I get that right?
Yeah, pretty close. Regional Medical Officer of Health, but basically the same thing.
Oh, semantics. But okay. Thank you again for joining us. Dr. Devinder was on the show a handful of weeks ago to discuss COVID, and since then, COVID has kind of decided that we weren't doing enough and decided to kind of take over. So we decided to do another kind of impact episode, and we wanted to get your take on it. So first off, how are you with everything and in general, and how you coping?
Great. Well, thank you both for having me back on again. I really appreciate being able to talk to you and communicate with your listeners. Sure. I'm doing well as can be expected in the circumstances. Everyone in public health is very busy these days. As you said, there's a lot of cases now in Manitoba in general, but also in particular in Southern Health. And everyone is just doing their best to try to manage the caseload and provide guidance to protect the health of Manitobans. And I just feel fortunate that myself and my wife were both doing well and healthy, and we're both just getting through the pandemic along with everyone else.
For sure.
Right.
How would you say, with the influx in Southern Health, what would you say is the biggest challenge, especially from your perspective, as I assume you're more kind of from above, I don't know kind of exactly what you do day to day with regards to whether you deal with patients as well or not, but in general, what would you say is the biggest struggle kind of in Southern Health? Is it staffing? Is it supplies? I mean, obviously the cases are going to be a thing, but I mean, aside from that.
Yeah, I think it's all kind of tied in together. So my role is to, review with the communicable diseases team in public health, which starts with the cases coming in and then going to the communicable diseases team where they're assigned out to the various public health nurses. Okay. The public health nurses actually interview the people that have been found to have a positive COVID result, gather information, try to, provide guidance on how they can protect themselves and their families, but also try to gather information about where they might have acquired the infection and who they might have been in contact while they were potentially infectious. Okay. That then goes to a communicable disease coordinator who's kind of like one of the quarterbacks to gather all that information and filter through some of it. And when a case gets particularly difficult, either because there's complicated circumstances involved or, it's really more difficult to try to identify that period of infectiousness, or if there's trends like clusters in a certain work environment or another environment, then that comes to me and I try to put those pieces together to try to, come up with advice to guide not just that particular person or their family, but also to try to, notice those trends to, as best as possible, either react or get on top of them and prevent others from getting infected.
For sure.
Yeah.
Right.
Would you say?
Oh, sorry.
Oh no. Continue.
I was just going to say, just with those increase in cases, there's just two things to try to filter out for me that have been more difficult. One is noticing those trends and trying to balance the whether or not extra precautions are recommended for either an individual or for a community or the region, along with the negative impacts that we do know are an unintended consequence of having restrictions, either for a person's mental health with isolation, or their business and their all the health related impacts that are tied in with the economy, those types of things. So getting that balance right is really quite challenging, and the more cases there are, the more opportunities there are for those challenging circumstances to come up.
For sure. Would you say over the summer when and I've heard Brian Pallister's answer to this, whatever, but over the summer with everything, when we were kind of really low on cases and everything seemed to be going well, do you think first off, what do you think was the second wave inevitable, kind of what we're dealing with right now, and do you think there were enough supports and measures, both planned or implemented, to deal with that?
Well, it's always difficult to say if something was inevitable. Looking back now, it seems like the obvious answer would be yes, but a lot of people probably would have predicted that the first wave, or the first time that we had COVID introduced to Manitoba, would have had a larger impact as well. Sure. So, it's extremely difficult to predict the impact of different infectious diseases, and this one seems particularly challenging to predict because of the nature of how quickly it's able to spread because of the lack of immunity, with it being a novel version of this virus, and also just the the challenge with those severe outcomes that are occurring because of the virus. So it's not only just spreading faster than the average flu might spread, for example, but the outcomes are also more severe than the average flu. So just this particular infectious disease is very challenging to predict. And I think that's why you're seeing not just challenges here in Manitoba or in Canada, but challenges in governments and communities across the globe with trying to contain this, not just in places where they don't necessarily have robust public health measures, like in some jurisdictions in the US, but in other countries in Europe or elsewhere where they have tried very robust public health measures, but they're still having very difficult challenges trying to contain the spread of the virus. So, the simple answer would be yes, a second wave seemed like it would be inevitable, but it's, there's a reason why the models that different governments are using to try to predict the impacts are, sometimes they're right and sometimes they're way off because it's really hard to predict.
For sure.
In terms of the precautions and the preparedness for this second wave, I can comment a little less about that just because of my specific role being regional and not being in the provincial fold with some of those preparations, where most of the planning occurs at the provincial level because of just that this is a provincial issue. Yeah. But for our team, we specifically did a lot of training on the electronic medical record that we use to enter in all of the cases over the summer to try to prepare. And in our particular region, right from the start, we had every public health nurse in the region have the potential to take a case, so that everybody was being trained at the same time to build that capacity right away, rather than having a dedicated team of a small number of people doing cases, which was another potential strategy. Because if that small team got overwhelmed, then we would be in a difficult spot. So I think that from a regional perspective, in terms of the teams that I work with, at least, we did everything we could to try to build the capacity for the potential for this second wave. But, even with that, the numbers in Southern Health per capita have been at times the highest in Manitoba.
Yeah. And yeah.
Do you know if we've seen a difference now that the new restrictions have come in? Are we seeing less contacts per person than we were potentially about a month and a half ago?
Yes. Yes, so we are seeing less contacts per person. Even a few weeks ago, the average number of contacts was around 5 or 6, and now we're seeing about 2. So we're definitely seeing those early indicators of the potential positive impact in terms of containing the transmission of some of the new guidelines and restrictions. I think we're still having to wait some time before the full impact of this really is seen in terms of case numbers, just because of the way that the virus works. And once one member of a household is infected, then it's very easy for it to spread to other members of that household. So, there's a certain amount of lag time in terms of once the transmission is broad enough to really have it contained. But we're seeing, as you said, less contacts per case. I believe that we're seeing just less movement overall. I think that there's some availability of looking at movement of cell phone data and just seeing that there's less movement among people since the province has gone into red. And also we're seeing a slightly lower test positivity rate in different regions in Southern Health for some of them, although in others it's still quite high, and in others it has been increasing. So mixed results there in terms of the test positivity.
Right.
That makes sense. Real quick, maybe this is I don't know, too basic, but maybe we should lay out, because everybody keeps, the people on the side of that this is, fake or a hoax or whatever, they keep saying it's just another flu. I think it'd be important maybe to lay out maybe what the average symptoms of, say, a flu might be, and how, since we're now 8-9 months into the pandemic, kind of what we currently know of what symptoms are and what we might expect, and kind of how they differ.
Sure. So the basic collection of symptoms being respiratory difficulty, either with cough or shortness of breath, having fever or a headache, nausea, vomiting, muscle aches, fatigue. Those general symptoms are actually very similar to what many people could experience with the flu or influenza. However, I would characterize the severity of coronavirus on average is probably 10 times worse than the flu.
Wow.
That's a fairly simplistic number to use. But if we were to look at things like how many people are in the hospital or the ICU or deaths, on average across the country, we might expect that there could be 3,500 to 4,000 deaths from the flu every year. And I'd have to look at the latest numbers for Canada now, but I think that we're at easily about 3 times that many. So I would have to check to get the exact number.
Yeah, we're at 12,000 right now. Yeah.
Sorry, what number?
Yeah, we just hit 12,000 in Canada.
Yeah, 12,000, exactly. Yeah. So we're at about 3 times that many already. Of course, that does take into account the first wave, but the majority of people who have died in Manitoba has occurred in the second wave.
Yeah.
So, we're seeing, and that's already just into the start of December almost. So we have a lot more of what would be a typical flu season, and I would expect that the season for other respiratory viruses, including the coronavirus, would be a similar type of duration. It could last until the end of the winter, and so that gives you a perspective on what we've seen already compared to the typical flu season for the whole flu season.
For sure. Speaking, that's actually a good segue. I've also seen some commentary about how some people are because how do I describe this? Because coronavirus is a broad catch-all. It includes many different things. Have seen many times people are talking about how if you test positive for COVID-19, technically it could just be some other corona, blah 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 blah. I don't know the specifics. Is there any merit to that line of reasoning at all?
So that would have been an initial consideration when scientists were first developing the test for COVID-19 specifically, because as you were saying, coronaviruses, there are several coronaviruses, and there are a few different ones that also infect humans, including what some people might think of as the common cold. However, when people are developing tests, there's two kind of measures for how well a test performs. One's called the sensitivity of the test, and one's called the specificity of the test. The sensitivity is how well it rules things out, and the specificity is how well it rules things in. And one of the things that they needed to check to see if their test was being accurate was whether or not it cross-reacted with other coronaviruses, because that could be a theoretic concern, but we want to see if it's actually happening with this test. And so that was one of the factors that was tested when these scientists were creating their various ways of detecting COVID-19. So yes, at the beginning, in theory, that was a risk that we wanted to make sure that that wasn't occurring. But now that the tests have been validated and we've checked for that exact thing, I would say no, that is not the reason that we're seeing all of these positive tests. It's because of COVID-19 specifically, not because of other coronaviruses.
Sure. No, that
right, because there was kind of a prevailing theory going around that they think these tests are picking up, a flu as opposed to COVID. So if that's not the case, do you think the flu numbers have been down overall just due to the increased hygiene of everything going on right now and people not getting together, that we're seeing less flu but more COVID?
Yeah, so it could be two things. The detection of the influenza virus, that's a lot better because that's a completely different virus than the coronavirus. So we can be very confident that when we detect a COVID-19, that it's not influenza, because they're so different that we're not worried about cross-reactivity there. It's right. With other coronaviruses that could have been a concern earlier. But in the Southern Hemisphere, as you may have read about, they only had about 1/10 of the number of influenza infections that they would in a typical year. Yeah. And, one of the reasons is likely because of all the various measures and precautions for coronavirus. Right. So far in Manitoba, we haven't detected a single influenza infection, and across the country there have only been a handful, but it is a little early. I mean, by this time we probably would have expected to have detected influenza, but still it would be a bit early for the influenza season, with the peaks actually occurring in January for one strain usually, and March for a different strain usually, but it varies every year.
That's incredible. Yeah, I mean, I did see an article about that there'd only been, like 12 or something across the country or something. And then, of course, people were picking on that as though, somehow that invalidates everything, blah, blah, blah. But that being said, if it is early, but it's also kind of leads its way to the fact that everybody is now, we're all Google doctors, and, that everybody's looking at all these different stats and as if we understand them, when we clearly don't. Like, at least us. You do, but Randy and I do not.
This is why we talk to you.
Yeah, exactly.
Well, even for people that have trained for a long time and look at this stuff literally every day, not just with COVID-19, but with science and scientific research in general, that there's always a certain amount of room for differences in interpretation. But, at a fundamental level, you'll get a lot of general agreement up to a certain point for those that have done a lot of training in the area. And so, there can be legitimate differences in advice about how to approach different situations because of either different, value preferences, or, the margin of error that can occur with some things. And so that that can occur with anything in science, including COVID-19.
Mhm.
But but generally speaking, those people that think that COVID-19 is not a big deal, or that it's a hoax, or any of that stuff, that's not coming from people that have trained in the area and are looking at this all the time. It's from people that likely wouldn't have that expertise.
Sure. There was a doctor from, I think, Alberta or something. I saw him making the rounds on Facebook, and I tend to be friends with people that like to share this stuff. Apparently, I don't know if you saw the video or if you're aware of this guy. I forget it's like Tomlinson or Todlinson or something, some goofy name. But it's kind of a bit frustrating because when there's one doctor that kind of aligns with this is a hoax, then suddenly that is also used as an example that it must all be fake because one doctor says it's fake. As a doctor and someone who's dealing with this on a daily basis, how do you handle that if someone with a doctorate can say those things?
Well, I think that, again, you find that with any topic. I think it isn't the statistic for climate change that something like 97% or 99% of scientists, at least that work in climate in any sense, have common agreement about the impact and trajectory of climate change at this point. But of course, there's the 3% or the 1% that disagree. In this case, just because someone is a medical doctor doesn't mean that they've necessarily received training in epidemiology and research design and statistics. And so you mentioned earlier that this is really complicated, difficult stuff, and statistics and epidemiology is extremely difficult to get your head around and to understand, especially when you have non-randomized control trials, what are called observational studies, or studies that don't actually have any kind of intervention, and you're just making an observation based on case reports or things like that. That it's extremely hard to understand scientifically what the probability of something happening a certain way or another way is, and whether or not the likelihood that it came out the way it was because the intervention actually was the thing that caused it, or it was just by chance alone. And so all that stuff is extremely complicated and requires people to go and get extra training on top of just being a physician. Yeah. The average physician doesn't receive a lot of training in that. And so just because someone is a medical doctor doesn't mean that they know how all of those various, fields of study apply to a given situation. And then on top of that, there are various other professions that are not medical doctors that can still have the title of doctor. So in some places, naturopaths are given that title, and some places chiropractors are given that title, but it doesn't mean that they're a medical doctor. It doesn't mean that they've gone through medical training in medical school and residency and practice it as a medical doctor. So, there's a lot of reasons why someone could have a skewed or erroneous interpretation of what either they're seeing or reading.
Yeah, that checks out, and that's an important point, and I'm glad that you made it.
Right,
Randy, didn't you want to talk about
last time
vaccines?
we had you on, we kind of spoke briefly about vaccines, and then we talked about sort of the early stages of the COVID vaccines were happening last time we spoke. I'm curious if you've read any additional studies on them, because it seems like Pfizer and Moderna are kind of the top two right now. And if there's any kind of information you could pass along about maybe their effectiveness as far as and I mean, if they may be coming. I mean, we hear that possibly a few months, but just the development of them and how the studies have been coming along.
So I only have the information that's been released out publicly, because the actual scientific studies of the phase 3 trials of the 3 vaccines that have had media reports, which is, as you said, Pfizer was one, Moderna was the second, and AstraZeneca was the third. They've only had their preliminary results in these media presses, not published results in scientific journals, so not their full results. But the information that you might have read, or that your listeners might have come across, is that Pfizer looks like their vaccine could have 90% effectiveness or efficacy. Efficacy is just the slightly different word that they use when it's a randomized control trial, but essentially means a similar thing to what people might think of when they hear effectiveness. So, so I'll just say effectiveness for now, but the technical word is efficacy. So Pfizer was 90%, which is extremely promising. Again, without seeing the full scientific results and methods, just in terms of all of the different groups that were included, either by age or what comorbidities or diseases they might have had, it's a little bit difficult to make a full evaluation of the results, but very promising, and I think a lot better than people were even hoping for with a vaccine for this virus. Of course, one of the challenges with that vaccine is the storage of it, having to be, somewhere between -70 and -80 for long-term storage. There is they are able to be refrigerated for a short period of time before they have to be used. I believe it's 5 days or so, if I'm not mistaken. Wow. So just logistically, it's a bit more of a challenge to make sure that they get shipped and stored in the correct freezers for that vaccine. But still very promising for effectiveness. For the Moderna vaccine, even better early results, 94.5%, just requires a regular freezing temperature of, I believe, around -20. So, more easy to transport and store logistically. And again, it can be in a fridge for a period of time before it has to actually be injected. So again, there's just some considerations there for how it gets shipped and stored around the province and the country. And then AstraZeneca, which had some conflicting results. So they had 2 arms for their trial. It's a 2-dose vaccine, but for one of the arms, the first dose of the 2 doses was a half dose, and for the other, it was a full dose, and then for both, the second dose was a full dose. And so what they saw in their trial was that those that were primed or given their first dose with the half dose actually had a better results with around 90% effectiveness, and those that got both as full doses only had somewhere around 60%. So a little bit, incongruous results. And so they're looking into why that might have been. A theory was that amongst the researchers was that the first dose being a half dose mimicked more what happens in real life, but tough to say for sure. And so I think that just being, conservative about how well it could do, maybe just more around the 60% mark, just to play it safe in terms of how well that might do.
Sure.
So those are kind of the 3 that are out there now. And fortunately, Canada has a purchase agreement with, I believe, all 3. And so while we don't manufacture any of those 3 vaccines in Canada directly, with having an advanced purchase agreement, I think that we could safely expect to start seeing some doses of at least 1, if not more, of those 3 vaccines in, January or February, assuming that they passed the regulatory application, because they still have to go through the same regulatory process as any other vaccine, and they've already submitted their applications to Health Canada, so I know that they're all 3 are in review.
Sure. Right. And so on that note, speaking of vaccines, have you guys started building the corrals into which we force everybody into to get vaccinated? And do the microchip serial numbers get emailed to us or sent in the mail? Or no, I'm just kidding. Okay.
Well, fortunately, we have a lot of practice. So, all of the regional health authorities in Manitoba just recently had all of their public flu clinics. In Southern Health, we had a whole series of clinics all throughout November. And I believe just finished our last clinics for the flu. And so that same kind of apparatus and that same process can be used for COVID to do these mass clinics, and just adding those specific logistical challenges with keeping the vaccine frozen and making sure that what's called the cold chain doesn't break and so on to make sure that it stays effective. But those are also provincial challenges, so we won't be alone in Southern Health with that. We'll have the province and the rest of the country to help us navigate through that.
For sure.
For sure.
Man,
Did you
good at this.
see a spike in the flu shots this year?
So I haven't gotten the latest data for the flu shots just because they've just been occurring, but we anticipated an increase in uptake, which is why the province did order an extra, I believe, around 100,000 doses more than they normally would. So we shouldn't have been limited by supply. It would have just been whatever the demand was for the residents in the various communities, but the province expected we could have an additional 100,000 people wanting to be immunized this year.
Right.
It went pretty smoothly, actually. I got mine, and they mentioned that they had been slammed and they were hustling, but within a half hour I got in, got my flu shot. Also, good on you for taking kind of a jokey question that I made and giving me a serious answer about getting it all lined up. So, I mean, obviously we're going to start dialing it down here. I was listening recently, Dr. Brent Rusin and others were saying that based on projections, they were looking at if they didn't do the code red and that type of stuff, they were looking at 800 plus cases per day, and we're currently not there. So it seems to be, quote, working. What do you see in the short term? Kind of, how do you see the next couple of weeks unfolding in your opinion?
Well, it's a little difficult to say because, as I said, two things. We got to a point with transmission, at least in Southern Health, and I'll just focus my answer on Southern Health because it's the area that I know the best, where the community transmission was wide enough that it was in, many households. And so it really needs to work its way through those households. And there's likely, not a lot of extra precautions we can do from that point of view. Like Dr. Rusin recommends not going to see other people, and there's the orders preventing people from going to other people's residences, but your family members or other people you're in contact with in your own household, that's likely going to continue to occur. So we got to that point, and that was reflected in our test positivity rates. I'm sure you heard about Steinbach's being, around 40%, and the rural municipality of Hanover was not much below that. So those are very high numbers, and that would be the case there. For some other communities, I have noticed an increase in their recent number of cases. So for Morden and Winkler, for example, more so Winkler, I've just been worried about the last 2 weeks in terms of the increase in cases there and their test positivity rate, which is around 25%. So, still very high. But after those kind of households are impacted, because as I mentioned, the number of contacts that everyone's seeing has dropped to an average of 2 per case, that if that continues, then that lends itself towards slowly a decreasing number of cases as the virus has nowhere else to go. But I still expect it to take some time before we get to that point. And because of that, I don't expect things in terms of restrictions or messaging to lighten in the coming weeks.
Makes sense.
But
Makes sense.
in the coming months, that could change slightly. Unfortunately, just the amount of global vaccine supply, I don't expect all Manitobans to have access to the vaccines immediately, but based on our purchase agreements, Prime Minister Trudeau recently mentioned that he thought that there could be vaccine for all Canadians who wanted it by September 2021. If the vaccine works as well as 90%, then and we need a herd immunity of about 60%. Then if you add the percentage of people that will have had the natural infection by then, just because of the spread of how it's been going, and you have, let's say 60% of the population getting vaccinated by sometime in the summer, then those two things together could be enough to kind of break the chain of transmission and get to a point where we're only dealing with small outbreaks just because it happens to get into a group that hasn't been immunized yet, but not the widespread transmission maybe that we're seeing now. But it's difficult to say. There's a lot of things that can happen between now and then.
For sure.
All
right. So in closing, we're all dealing with a difficult time. Some of us are more on the front lines than others, clearly. And again, last time we spoke, we thanked you, we thank your team, and we do so again, and perhaps even more. Thank you to all the doctors and nurses and healthcare frontline, everybody that's dealing with this on a regular basis. Let's all stick together and try and get a handle on this. So thank you for doing your part, and thank you for joining us again.
Thank you very much.
No problem. Thank you both for having me, and again, thanks for getting the messages out to your listeners.
We try. Whether anybody wants to listen to us, I don't know, but hopefully they want to listen to you. So, all right, Dr.
Happy
Singh,
holidays, and take care, both of you.
You bet. Have a good day
as well.
Bye.
Thanks. Bye.
We are joined now by the Manitoba NDP leader, the provincial official opposition officially for the first time, our three-time guest, which is just a thing. So you're the very first person to be here for 3 times.
That's my air horn.
The triple crown
for the achievement. Yeah, unlocked a new level.
If you would have told me before we started that our first 3-time guest would be a provincial leader and not just a boneheaded friend of ours, I wouldn't have believed you. But here we are. Anyway, welcome here, Wab.
Yeah,
of course. Welcome.
Thanks for having me.
Yeah, Mr. Wab Canoe. So basically, on to more serious things. The reason we wanted to touch base with you again was Manitoba is currently in the midst of COVID, full stop. It's ravaging the province, and basically the goal with this is to be included with other conversations to make a kind of a COVID impact episode. So we wanted to get kind of your take on it, and we can go from there.
Okay. Well, I think the situation's really, really serious in Manitoba right now, and I mean, you guys are in one of the major hotspots. Steinbach and surrounding area. So, I think everyone's got to take seriously what's going on and band together. And, I think that on the one hand, you got a lot of doctors, nurses, healthcare people who are ringing the alarm saying the healthcare system's under tremendous stress and we got to slow down the spread of the virus, which means, a lot of closures and restrictions and public health orders. And then at the same time that that's happening, I also hear from a lot of friends and acquaintances who are really frustrated about going back on a lockdown, just like, from their own personal perspective. And, I understand where they're coming from because
For sure.
I think there's a lot of mistakes that were made in Manitoba. Like we could have maybe prevented not the second wave entirely, but we could have mitigated it. Like maybe the second wave wouldn't have hit as hard if we would have done things like use the summer months to get the healthcare system ready, or maybe not cut healthcare last year as the government did. That would have given the system more time to respond, more capacity to respond. And so, like, I get it. People are frustrated because where the government failed, now it's up to the people to kind of pick up the slack. And the way we pick up the slack is by staying home and wearing masks and following the public health orders. So, as much as people do feel frustrated, I hope they understand how important it is.
Sure.
In Southern Health and in the southeastern part of the province, you've actually seen not people passing away. You've even seen people who work in healthcare passing away, healthcare aides. Mm-hmm. So it's really, really serious. So I hope people, even if you do feel frustrated, that you just kind of like, yeah, I don't like it, but we're going to do this thing because it's really only through collective action, like all of us acting together, that we'd be able to stop this thing, slow it down.
100%. And that's
for sure.
Yeah.
Sorry, I kind of had I've sort of had an issue with Brian Pallister too, and no one knows I'm a huge Pallister fan to begin with, but yeah. I feel like, do you think people would have been more ready to band together had they kind of taken some of the ownership of the rise we're seeing in cases now? Because it seems like every time he holds a conference, it's, Manitobans are screwing up. It's your other people that are hurting us, right? When, they could have done a lot different to, say they had kept restrictions capped at 100 people or 50 people for the whole summer rather than, okay, let's go 500 people for outdoor gatherings. There's a lot of onus, I think, on them that they did things a little too quick, and I don't think they're accepting that responsibility. So do you think if he had come out and said, okay, we kind of messed up, we sort of need everybody to band together now, rather than hold the citizens accountable, that people would be jumping on the bandwagon a little more?
Yeah, I think that's definitely part of it because, he's coming up, or he was coming out at press conferences telling people grow up, or, you got to smarten up. He's just being insulting to people. Mm-hmm. And, anyone who's been a teenager and has had a parent or teacher or coach try to yell at you and get you to change your behavior knows how that's not effective, right? Mm-hmm. Or if you're a parent yourself and you're trying to take that approach with your kid, especially with a teenager or young adult, it's not going to work. So that like stern dad, strict father kind of approach, it doesn't work because we're all adults, right? So you can't mm-hmm. talk down to us as Manitobans.
Yeah.
But at the same time, I think it's not just the fact that he's talking that way to people and not accepting responsibility. It's also the mistakes that they made. Like if you think about the healthcare system as like a living being, basically what they did is they cut it down to the bone last year and the year before. And so when COVID hit, there was no slack. There was no capacity to respond. It couldn't absorb anything further because it was already right down at the bone. But had they had a bit more of an investment in healthcare, or even if they would have used that period earlier this year where there weren't any COVID cases in Manitoba, if they would have used that time to hire more doctors, hire more nurses, get all the preparations in place, that would have given the healthcare system more capacity to respond when this fall wave hit. Because, I hope folks appreciate that there's a few factors that lead to the restrictions coming into place. One is the case counts and the test positivity. So like when the test positivity goes to 40%, as it did in Steinbach this past week, you probably need to put in place more, or you definitely need to put in place more restrictions. But it's not just the case counts, it's also the hospitals too.
Yeah.
So if you got the hospitals in Winnipeg, which is where people get sent to when they're really, really sick from everywhere in the province, even if you don't live in Winnipeg, when the hospitals are full here, then they have to put in restrictions too, based on that. So basically, long story short, if we would have had more testing and contact tracing capacity earlier in the year, and if we would have had more resources in our healthcare system, then we could have seen restrictions come into place more slowly, and maybe we could have even prevented things from getting out of control, as they clearly have in a lot of areas.
100%. as to an earlier point there, where you mentioned that people are fatigued and we're tired and fed up with restrictions, and from my perspective, it feels like it's mostly because the flip flopping. Like one day it will be one thing, the next day they'll pull part of it back, but then the following day they'll push more things back. What do you think? Whoever's doing the branding, the messaging, what do you think they could have done better to handle this, to really get the message clearly, concise? Kind of, how do you think they should have handled that?
Well, I think going back into the summertime, after that spring lockdown, I think everybody wanted to get out there and enjoy summer, whatever that means for you, whether that means going to the lake or just spending time outdoors, maybe playing sports, just going for a walk, taking the dog out, whatever. I think everybody wanted to enjoy their summer. And so I think that the communication should have started there. I think that the communication should have been like, all right, listen, great job, everybody. We have really low case counts now. I hope everyone can go out and have some fun this summer, but be aware that the virus is still with us. It's not going away. We didn't beat it. Instead, you're going to be able to have some fun this summer, but be prepared that we're probably going to have more restrictions later on in the year. And in order to make those restrictions be less severe, wear the mask, keep your group size down, keep these restrictions in place. So if it would have been just a little bit more caution earlier in the year, whereas what we got from the provincial side, it was really more of like they hung up the mission accomplished banner and they're like, all right, ready, set, go. Everybody, go out there and, do whatever you want this summer. And then basically what we saw is that starting out in Westman and Brandon, you started to see outbreaks. Then that made its way across different parts of the province. And then now like we have huge outbreaks in Winnipeg, in the south, in the north, all over the place. But, I think if the messaging would have started with a little bit more recognition that this thing isn't over, you can do some things, but it's not a return to normal, then I think that would have helped lay the groundwork. And everybody, I think all summer long would have been aware that like, yeah, okay, maybe we'll be able to go to the lake, but at the same time, it's not a total return to normal. And then more recently, like all the flip-flopping and the lack of clarity, I think it just frustrates people. And it's just part of the overall approach of the government. Like, I think at this point, everyone recognizes that they failed to prepare for the second wave. I think everyone feels that way. And because everyone feels that they didn't prepare, any time that they come out and it's not like a total, mea culpa, as you were saying, like, hey, listen, guys, we screwed up. Listen, folks, we screwed up. Here's what we need to do together to get things back on track. The fact that they're coming out and, they're blaming people or they're being combative and they're, trying to shame, then I think that, that turns a lot of people off. Which, if it was just a political issue, that would be one thing. If it was just, people are shrugging their shoulders or shaking their heads at a politician, whatever. That's always the case, right? But what really makes it bad right now is the fact that there's lives and health and, just the normal operation of schools and workplaces that's at stake. So it's much higher intensity. It's much higher stakes right now. So when the government does get it wrong, it's not just like, those goofball politicians are at it again. When they get it wrong now, it's like, okay, well, now schools in one region are closing, or unfortunately, people's health is taking a nosedive, or we may even be losing people. So it's really, really high stakes. And that's why, that's why we're making these suggestions. We're trying to improve the response because, again, if the response even improves by 10%, 15%, that makes a huge difference for people across the province.
For sure.
And frankly, not doing a provincial mask mandate until now was irresponsible, in my opinion, because it showed in Westman that it worked. Like the minute they implemented masks, their cases dipped, and then but by then it had already spread.
It almost felt like they were too scared to pull the trigger on it in Winnipeg for fear of a pushback by the people.
Yeah, I don't know what they were thinking. I do think that they were afraid of like their base, like the conservative base, being opposed to it. But I don't know. I think most people are fine with it. I recognize obviously there are anti-maskers out there, but I think most people get it. And when you think about if we could have been mandating masks in August through September and October, and then maybe the case counts wouldn't be as high as it is now. It seems like that's a pretty small impact on people's lives, because at this point most people are wearing masks anyways when you go out into public or you go out into the store. So just having had to do that for an extra couple months, I don't think that would have been a huge impact on people's lives compared to how big this current round of restrictions is. This is much bigger than that would have been.
Do you have any specific stories that stick out to you that you've heard of, whether it's a healthcare professional dealing with this specifically, or perhaps just a hospital being overrun, or do you have any anecdotes that you've heard that really stick out to you of how people are struggling or overcoming the COVID situation?
Well, there's a bunch, and there's a lot making their way around social media this weekend. I'm sure you've seen some Facebook posts about healthcare aides and their kids and stuff like that. But I've spoken to a lot of people in healthcare, and including the hospitals in Winnipeg. And without identifying them, I think it's fair to say that they're frustrated, because they're the ones who have to deal with any type of failure. Like if we as Manitoban, like first, if our government failed as it did earlier this year, they're the ones who have to deal with it, because they're the ones who've been working 16, 18-hour days for weeks on end at this point, and are seeing people getting sicker, and are seeing, unfortunately, people now of all ages passing away. Like we had a 20-year-old, we had two 30-year-olds pass away in this past week. It's really serious here.
Yeah.
And if we don't manage to get a handle on it as Manitobans, they're the ones who are going to continue having to deal with it. So I think probably the thing that stands out to me most, and I'm sure this is everyone listening, this is their experience too, is that when the first wave happened, the first lockdown happened, COVID seemed like something that was on the news, or was something that was on TV, it was something that was on social media. But now somebody, whether it's somebody who tested positive, somebody who's self-isolating, or maybe even somebody who's passed away.
Yeah.
And so this thing went from being some abstract idea going on out there to something that's affecting all of us in a much more direct way. And so, to me, that's the biggest change is, one, the healthcare system getting overrun, and then two, just the impact on the everyday person's lives.
Absolutely. We discussed briefly when I had reached out for you to come on this episode, and we discussed that we could touch on briefly. How would you think you could persuade people without alienating them? Because that's a huge thing. People are super divided and divisive and dismissive of people with opposing views, especially with COVID. How would you say we should handle that, or do you have any thoughts on that of how to convince people without getting them entrenched?
Well, it's pretty frustrating, like when you see the anti-mask protest that happened in Steinbach. Like, so that turns a lot of people off, and then when people are turned off, then they'll just say stuff. And then that small minority of people, they'll get further entrenched. So, and then the other issue is like with the news, like with how many people were really at that rally, and yet it was probably the biggest news story in the province that weekend. Yeah. So that even though it's a small group of people, they get this huge platform, in part because of media, and also in part because of social media. So like, how do you even talk about the issue without amplifying that message? To me, those are really important questions that we got to sort out. I think there's kind of two major things. One, because I think a lot of the conversation, it deals with people's rights. Like either I have a right to say no to a mask, or I have a right to leave my house if I want to, kind of thing. But I think what people don't understand about human rights, about our constitutional rights, and about really any interpretation of rights is that, yes, you do have rights, but your rights begin to end when you start to impact the rights of other people.
For sure. 100%.
Right. And that's true everywhere. That's true in our Constitution. That's true just in like the general idea of how people think about rights, and that's why, for instance, like you can't, take something from somebody else, even though you might have a right to do whatever you want. When you start to impact that other person, your right ends. And then that's why the state can come in and take you to court if you're being bad, as an example. And so we seem to have forgotten that part of the equation, that it's not just about you. It's also about us. You know what I mean? And so we as individuals, we're part of a society. It's not just all of us as individuals going out there. It's also that we have to work together. And so in some cases, you may have a right to say, you know, your opinion. But if your opinion harms other people, then that's where that right begins to end. So anyway, so all that to say, I think that that's part of the conversation. We need to just remind people, like, it's not just about you and your rights. What about the right of the senior citizen to live? What about the right of the child to grow up with their parents? What about the right of the kids and teenagers to be able to go to school?
Yeah.
So, you know, you may feel very strongly about your rights, but you also have to balance them with how your actions are going to impact other people.
Mm-hmm.
And that's just being a grown-up. We all learn that, right, as we're growing up through life, that it's not just about us. We have to think about other people, our spouses, our friends, our, you know, fellow community members.
Wow.
So I think that's part of it. And then the other part too is just, you know, people need to understand what numbers mean. You know what I mean? Like, you see a lot of stats or data get tossed around, or people make arguments. They'll say, well, like, what about Sweden? You know, but then they gloss over the fact that Sweden has really, really tight restrictions on group sizes, and they have a way higher death rate than the other countries with a similar healthcare system to them. And so, and they have a really high tax rate too. And so I don't hear people advocating for the Swedish tax rate, you know, in Manitoba, but they cherry pick like, you know, the Swedish lockdown approach. Similarly, I see other people saying, well, the CDC says, you know, survival rate for this group of people is this %. So really the coronavirus isn't that bad. But then it's like, well, listen, it may sound like a low percentage wise, but multiply that over 1.3 million people.
Exactly.
That's tens of thousands of people that you're potentially, and this is why I say, like, we have to help educate people, because they may not actually realize that. Like, when they make that argument, what they're actually arguing is that, you know, tens of thousands of people may pass away from this thing. So we've seen like around 200 deaths so far in Manitoba, which is already tragic and, you know, preventable. But imagine like a number 10 times that. Even more than that. That's potentially. So anyways, long story short, we got to help people, like, I guess, just think through the arguments and think through what the numbers actually mean, because by any measure, if you're looking at the data correctly, this virus is a huge problem. This virus is very, very dangerous. And so I guess maybe we just need people to be patient and sit down with those folks and say, listen, you're advocating this, which would lead to that, and behind every one of those numbers there's a family. Here's an example. Like, I was talking to a person that I know, and they were using that Sweden example, and they said, like, the number 6,000. They said, you know, they had 6,000 only, I think is what they were arguing. They had only 6,000 seniors pass away. And then I just said to that person, I said, like, that's a high number, but guess what, that's not just a number, that's 6,000 grandmas and grandpas. And then that actually stopped that conversation in the tracks. The person was like, whoa. I assume they pictured their grandma and grandpa, and then they're like, whoa, we should be protecting them all. So I think that's part of it too. Just, you know, it's not just percentages and numbers. It's like behind every number is a person, is a grandma, a grandpa, a mom, a dad, a son, a daughter, you know, a cousin, a relative. So we got to help people form that link, that relationship.
For sure.
Oh, for sure. To get the empathy. It's so easy to say, well, it's only, you know, 1% or 2%, 3%. But then, and if you're looking at it in the case of, say, your personal family, which is whatever, say 100 people, and if only one of those people might die, some people are okay with that for some reason. But then if you extrapolate that, like you say,
terrible.
Over the whole, or they don't even think of it as someone in their own family could die. They think of one person in someone else's family is worth it to them. But
with those people, it's always until it happens to them, they're not going to worry about it.
Yeah, exactly. So we need
that's
to work
probably
on the
part of it too, unfortunately.
Yeah.
But I mean, the situation that, you know, you're seeing in southeastern Manitoba, you're seeing in Winnipeg, you're seeing in parts of the north, it does mean that it's getting a lot closer to people. And so I hope people just recognize that there's something bigger than each of us as individuals. This is something that we all have to do together. You know,
for sure.
There's a lot of issues that we can do individually. Like, you know, we can think about just my job or my, you know, education, my college degree. But this is one where we should be thinking about it as all of us together, because the only way like the virus itself, it can only last in the air for a few hours. It can't last, by itself. It needs a human host. In a given human host, it's not going to last that long. It's going to last maybe 2 weeks unless the person actually gets sick. The only way the virus can actually live for an extended period of time is if we, as a group of people, don't listen to the restrictions and we interact with each other, and then the virus can jump from host to host. Yeah. So only our downfall can be our collective inaction together. And then on the flip side, our solution or our savior would actually be us acting together in a good way and abiding by the public health.
I love that. You're absolutely right. And that's, again, that's sort of the point of this episode that we're doing, because we're hoping to compile multiple perspectives, is that we need to work together, be a community, be empathetic, be responsible for everybody, not just for you. Don't look at masks as an infringement on your rights, but look at them as a way to help your neighbor and help your community and help your grandma. Like it's the same as following the speed limit or not drinking and driving or not smoking on a plane. It's,
the way I've always related the argument is, like, at best, you're saving someone's life.
Yeah.
At worst, you're wearing a piece of cloth on your face for 20, 30 minutes at a time. It's not that big a deal.
Bingo.
Yeah,
exactly.
No, I think that's right.
So to close up here.
Yeah.
Oh, sorry. What were you gonna say?
No, go for it.
Basically, to kind of end this year, do you think, is it too late? Like, do you envision us getting this under control? Do you think there's enough oomph behind whether the government or the messaging or anything for there to be, for us to actually, flatten the curve like they want us to do? Where do we go from here, essentially?
We are going to prevail over the virus eventually.
Mm-hmm.
Like I was saying, there's enough people who are thinking about this in the right kind of way, who are abiding by the public health restrictions, who are wearing a mask, who are doing the right thing in the community, that eventually we will come out of this thing for sure. But the question is, how many of us are going to come out of this thing?
Yeah.
And unfortunately, what we've seen is that not all of us are going to survive the pandemic. But I hope that through seeing this thing come closer to you, through thinking about what the impact is on families, friends, communities, through, just maybe taking some time to think about, in our life, it's not always just about us as individuals. It's also about us as a community, that hopefully we get more and more people on side. I think the vast majority are on side, but we get more and more people on side. And then through that action, we can make sure a lot more people survive the pandemic.
100%.
And some of the things that we can do along the way, if people are frustrated and if people do want restrictions to be loosened, is we need healthcare, particularly the healthcare staffing, to be increased. Like in Southern Health, personal care homes have been cut, home care aides have been cut. So you gotta undo that, because you need people at the bedside to take care of the seniors living in the seniors' homes. You need people in the hospital. You need people to go out into the community and do healthcare. That would help. We need more testing and contact tracing. Like, if you got 40% of the people coming to the testing site in Steinbach and turning up positive, that means there's way more people out there who are not getting tested and have the virus.
Yeah.
Mm-hmm.
So we need more testing to get a picture of what's going on there. And if we did all of those things, including maybe things like calling in the military in some regions where we don't have the staff to care for people, or calling in the Red Cross to offer that healthcare. If we did all those things, and we did on our side as the community members, respecting the public health advice, keeping a distance from each other, maybe doing, Christmas by Zoom for the extended family, things like that. Obviously, we're still going to celebrate Christmas in our own homes. But I mean, just like in terms of talking to the cousins and in-laws and all that. But if we did all those things together, then I think we could bring the numbers down more quickly. And if we did that, and we had a strong healthcare system, then that means that the restrictions could come down more quickly as well. But again, like, they've got to be there until it's safe to do so. So part of it's up to us, part of it's up to the government. Right now, I think that it's kind of, the imbalance is being put on the people. It's the people shouldering where the government dropped the ball earlier. Hopefully the government will pick up the ball and improve things on their end, and Manitobans will continue to do their side, and then we'll all be able to, get a little bit closer to normal sooner.
Love that. That's I think that's a solid.
Well said.
Yeah, I think that's a solid place to end it. Unless there's anything else you want to mention, Wab, appreciate your time.
Thank you very much.
Yeah, well, 2020, 3 appearances on the podcast, so we'll look ahead to next year.
Let's double it. We'll get you on as a regular host.
Yeah, every 2 months.
Awesome, Wab. Thanks again. Stay safe.
Good.
Thanks, Wab.
Cheers. Thank you again for joining us, Dougal. Second appearance on the Two Idiots podcast. A bit inauspicious, I guess, but still good to have you. Either way.
Yeah.
So.
Yeah. No, my pleasure.
Yeah. Thank you for coming here. So, again, for a brief introduction, the leader of the Manitoba Liberals, Mr. Dougal Lamont. Say hi.
Thank you. Yeah, and MLA for St. Boniface. So.
Sure. I've seen your pictures.
I think when people say that I'm the leader of the Manitoba Liberals, they just think it means like I'm a president of the federal party, which I'm
for sure. Makes sense. He's a local guy running for local politics. So, yeah. Speaking of local, the goal of this episode that you're now included in was to kind of highlight the issues surrounding Manitoba right now, because we're getting slammed with COVID and the responses have been mixed, and kind of we're trying to get the political perspective from you and Wab, and so tell us kind of what's your overview, what's your view from 10,000 feet?
Well, I mean, I think the more we get into it, I think what sort of happened, I think in June. Actually, the one thing we were just talking about, I was saying that I can be a bit of an anxious guy, but I'm sort of at least conscious of not of declaring victory too soon, right? And I think that's kind of what the PCs did, right? So I'm lucky. I used to work at the International Center for Infectious Diseases in communications during the H1N1 pandemic, which was nothing compared to this one. It was still very serious, but I actually worked there and worked on small business preparedness. I actually helped do a bunch of stuff for a national thing to help get small businesses ready, which hasn't really happened even in this one. So what's happened is that because I work with John Gerard and he's a doctor, and I used to work there, and our other MLA, Cindy Lamoureux, worked with seniors care homes. She worked at the Long-Term Care Association. We all have like a fair bit of expertise, but some of it was just that John Gerard himself, he's not just a doctor, he used to teach doctors. He was a professor at the med school, right?
Sure.
So like March 2nd, we said, well, here's the 5 or 6 things this government needs to do for its pandemic plan. And that's before we had a single case here. So you got to protect personal care homes, First Nations. You have to make sure that low-income people can afford to eat. You need a central command system that's sort of apolitical, that's running, and a lot of that stuff they just haven't really done. And they had a big ramp up in spring, and I sort of think they thought they were done in July, right? I think, which I don't really understand. One of the reasons why I thought there's no way we're done was because we were looking at what was happening with cases in the States, right?
Yeah,
cases in the States are going up, and throughout, we kept saying, well, here's the things you need to do to prepare for the second wave. Like in May, we said, you need rapid response teams, 3 rapid response teams to deal with personal care homes. There was a bunch of others, and we kept kind of warning, right? But I think that the hard part of it is just that I think they were, I don't really understand why, but some of it is that there was actually, you know what, I'll say, I do understand why. It's partly because this all happened in a U.S. election year, and everything became political in a way that it really would not. If this had not been in an election year in the States, in the craziest election in history, the U.S. basically became like a public health menace, like it both in terms of cases, but also in terms of information, right? So you had people saying this doesn't matter, it's a hoax, all sorts of folks, right? And people were buying into it, right? And we were dealing with that all along, and that's part of it. Is like it's really hard to warn people about about just how dangerous it is. Like there's no when they don't have any experience of it, right? It's like it is really hard to convince people that this thing that you can't see is going to come and kill a whole bunch of people, right? Is that's part of it, and what the actual amount of risk is. And when you mix politics into that, it gets worse because people just don't believe what you have to say. Like I used to joke in a sad kind of way, or it's sad now. I used to joke that because we're so partisan, like I could be standing on a I may have made this joke to you guys before, that I could be standing on the side of a highway with waving like red flares and flags and saying, like with a PC bus hurtling down the highway saying, stop, the bridge is out. And they were just you're just saying that because you're a liberal. Like, no. It's like sometimes the things I'm saying there, I'm not just trying to score points. I'm not just trying to make people look bad. I'm actually trying to say, look, there's this thing going on. You've got to like look out. And so now we're scrambling and we're super behind. And that's been the frustrating part, is because we've been saying, well, here's the things you can do, you should be doing. And they're starting to do them now, but it's not that it's too late, but it's really hard to be doing things. Well, it's like sandbagging it's the difference between sandbagging before the water's there, right? Mm-hmm. And all of a sudden the water is in your basement and you're trying to sandbag. That's the kind of deal.
Well,
it's or waiting till the whole block is on fire before you call 911.
And while you're sandbagging, you have some people actively removing sandbags. But be that as it may,
true. Yeah.
With your experience, yeah, exactly. With your experience working with infectious diseases and also with Cindy Lamoureux, so you have a close tie with that. Do you have any stories that stick out, or any anecdotes of the struggles, or of people persevering, or the local healthcare pros that are just dealing with this right on the front lines? Do you have anything to say about that?
Yeah, and that's part of what's super hard, actually, is that as we get emails all the time from people and who were frustrated and desperate. One was, the thing with Maples is I heard that there had been ambulances at Maples, and then I actually had a friend, Eddie Callisto Tavares. She was all over the TV, but she'd gone in there to be with her dad, right? Where we had been asking for help and sending people into Maples. We actually had a press conference with her, and it was at 10 on a Friday. I guess it was 2 or 3 weeks ago. It was before the Maples crisis, because she was pleading for help to try to get people in there. So we have the press conference at 10, and at 11 she finds out her dad is COVID positive. She signed a waiver to go in and work for herself, so she was actually able to say, when at Maples, when they said, "Oh no, there's lots of staff there," she said, "No, there weren't." She was actually there to be able to say there were people there who weren't trained. There weren't enough people. There were people calling out for water. Like it's beyond anything you can imagine. And then on the Saturday, I got a guy I know emailed and said that he got at 11 in the morning, they said, "Oh, by the way," he'd been getting email and robocall updates every single day saying everything's fine till Friday night. The ambulances are called. Saturday morning, they say, "Oh, by the way, your father isn't taking food or water and he's non-responsive." Oh, wow. And he was dead by 6:20. So wow. And then on top of that, but you also have all those people who are working so hard, doctors, nurses, and teachers. And the frustrating thing for them, and again, the hard thing, is that I have people calling out to me saying, "What can we do?" because they feel powerless and helpless. So the one thing I always tell everybody is actually speak up, right? That's the one thing, because people can't go on strike. They can't really stop what they're doing. They can't hold things up because that'll just make everything worse. So the one thing you can do is to get a hold of us or get a hold of the media and let people know, because that, unfortunately, is what's driving the change, because the government is being more reactive than taking initiative. Yeah. But yeah, Eddie, she's an incredible person, and and there are, and look, you've got people who are working incredibly hard to do this stuff, but it is this heartbreaking thing of and it is. I don't ever of saying like of the government for the government to say, well, we didn't think this could, or there's no way anybody could predict this when we literally said, well, this is going to happen in May. And it's a horrible, and like there's a point I think I said I was sick of being right. It's like I'm not happy about it or pleased about it. Like it's a horrible thing for these things to happen and actually sometimes even be worse than you expected. So
for sure.
But the flip side of that is there are still things that people can do, right? Is that's the one thing is that because people feel very powerless and don't know what to do because it's a crisis, the one thing you can do is call for help, is ask for help and speak up. Like those are two really. This is not a time for anybody to be covering anything.
But that's what's especially difficult is in preparation for this episode, I've reached out to several nurses, a few doctors, and then had friends indirectly do the same. And most, in fact, all so far are terrified of being reprimanded for even speaking out publicly, or even apparently there was someone that had been reprimanded for a Facebook post. There are people that the nurses are quitting and then speaking out, or they're worried they might get fired. And I mean, I understand we're trying to avoid public panic, but we can't have the people dealing with this on the front lines handling it themselves and not being able to speak openly about their experiences, because then
absolutely
the people on the outside have no way of knowing what the issue is.
Well, and that's exactly it, right? And I always thank people for speaking up, and we do. Like, I encourage people to speak up and let us know and reach out to us, because we understand confidentiality in getting this stuff out. But it is incredibly hard because there are all sorts of rules around it. But it shows actually how broken things are, that people are not actually able to say, look, here's this problem, and it doesn't get dealt with, right? So that they're in this, if they're at the point when they have to sign have hundreds of people signing letters, like we're beyond the point. Like there are supposed to be official channels for all that stuff to work. Actually, and I'll say that one of the big picture of this, the way this thing should have been run is that somebody else should be in charge. Like we called for Friesen to resign or be fired, but like these things have to be taken out of political hands in a sense. Like there are people, and there should be an emergency organization, and so there's the public health and emergency. Those are the two big things. Emergency then the politicians should sit back, let emergency organization, EMO, emergency measures organization, do what they want, and you just sit and cut checks. Like that's in my humble opinion the way it works. So, and you let them. They book spaces, they find stuff, they say, okay, we're going to take over these 3 hotels. We're going to take over the convention center, and we're going to make it work. We'll pay you later.
Yeah.
And that's basically what sort of happens. So you have essentially a crack team of people doing all this stuff, but we're still at the point. Like today, there was a Simkin care home, and they're asking for volunteers to go in and feed people. As a preventive measure, but this isn't the church picnic. This isn't like it is. I find it's quite painful, actually. I mean, it's very distressing, and I'm also dealing with it's like there's lots of people who are reaching out to me who are distressed for those very reasons. But we have been able to get action. It's just like pulling teeth.
For sure. And full disclosure, we reached out to Mr. Cameron Friesen, and he politely declined to join this conversation. No, I'm not surprised, but in fact, I'm more surprised that people actually say yes to joining us, frankly. So,
I'm known for my low standards.
Clearly, perfect.
But to move forward, I mean, we don't want to take too much time. This will be part of a big group effort. But moving forward, we're recording this on November 22nd. 243 new cases were reported, which is trending in the right direction, which is great. Not to say that we're out of the woods, but how do you see it going forward? Do you think we're actually on the verge of getting things under control? Do you think we're slowly moving in the right way? How do we go forward?
And what measures would you be enacting, depending on what you think, what direction we're heading in?
Sure.
So the one thing I'll say is that I asked, because the thing is that our test levels are fairly low. So it's 21. So that's 240 some cases, but it's 21.
It was 2,112 tests, right? I think. Yeah.
Like we should be ideally we'd be at 5,000 tests a day, right?
Sure.
and that I know that there are lines for tests. So, and the other is that if you look at the curve of how these things go, it's like a saw. It's like a sawtooth. So it goes up and down. Like there are these little peaks and valleys every few days, right? So you go up and you go down, you go up and you go down. My concern, I mean, I look, there are things we need to do. If you have a hard shutdown and you really stop limiting things, you can cut your infection rate in half, which we desperately need to do. There are areas where they should probably be calling in not just the Red Cross, but the military to make sure that there's enough people. The one bottleneck right now, I from what I understand, is staff. Right, so we actually have enough equipment and other things. We've also suggested. So the basic thing we said is go for a bigger shutdown, but also have a bigger support package for everybody.
100%.
Like that's where the reason where we are now, where we have massive outbreaks, and Steinbach has 10 times the cases of the rest of Canada, the infection rate, like really bad, is partly because of this. People thinking that we have to reopen everything to make the economy work, right? What you need to do is to be able to put public health first, and then say, okay, we're going to find ways, basically, to reward people for staying home. So this is probably the biggest single difference between actually what we are saying and certainly what the PCs are doing, but even what the feds have done to a certain degree, is to say help. We've got all these little bitty programs that sort of help one business here, and doesn't help another business here, or it helps some workers, but others are left out. Just find some way that covers everybody, and make it relatively simple. Just say we're going to replace revenue. So for whether it's for an organization or a business, just for the period of shutdown.
Yeah.
So you won't go broke. You'll be able to pay your employees. You can pay your rent. You can pay yourself, right? There are all sorts of businesses people haven't been even being able to pay themselves, and they haven't qualified for any programs to date. And the other is you actually need to be you can't expect people to stay home and starve. You cannot expect people to I need you to sit at home for 3 weeks with no revenue, with no income. And how are you going to buy your groceries, pay your rent, all that other stuff, your heat? Like, it's not realistic. And the big difference is that the PCs have very much gone the punishment route, right? To say, well, people are being bad, and we're going to come up with some big fines, and we're going to spend $2.5 million on a private police force to slap fines on people. And my attitude was always, why don't you just reward, instead of just punishing people for doing the bad thing, reward people for doing a good thing.
Yeah.
Because that's actually there's a reason why people are making those choices, is that, okay, well, I could go out and get a fine, but if I stay home, I'm going to go broke. So it's no choice at all, right? Like that is the choice people have been forced to endure. So that to me is that recognizing that the two things together are inseparable, right? We haven't had a good, and that missing response, that is why things keeps collapsing and failing, because people have had no choice but to go out and keep working. So, and actually, I'll just give an example. So one of the things Eddie said about the Maples home, because the province has said you have workers who are in it's only one worker per home, but that worker, once you said, well, you can only work at this home, that worker can't get the hours anymore to pay their bills. So they'll go and they'll clean in a hospital, and they'll work at Superstore or Walmart or wherever. So they're working 3 jobs, and one of them is one where they're COVID exposed. So that's a recipe for everything that's been happening for transmission. So the other is that for all this gloomy news is that there is going to be a point that this is all going to be over. We'll look back on it as a memory, and we'll all have some variety of stories that'll either be, they'll be what you'd think of as war stories or terrible stories, because so many people have had, some real tragedies. But the other is that, look, there is a point when this is going to be all over and done. What we need to focus on right now is making sure that we keep as many people, that we try to preserve the things we love, starting with people, and then businesses and all the wonderful things that make up our communities. We don't have to this is the thing. We don't have to sacrifice all this stuff. There are things we could be doing. There's like a $600 million rainy day fund. We could be putting it into making sure that people can pay their bills, that businesses don't go under. The resources are there, right? Like that's and that's and especially in 100-year crisis, right? Like this is like, and this is like I'm at this funny. I'm at a weird age because I'm 50. Then I was one of the last kids, and my dad was the youngest, and his parents were old. So yeah, I have like all these grandparents who were like in the First and Second World War and the Depression, and we heard about it all the time.
Right.
So, but when you hear talk about people being, these are not, and the pandemic, like my grandmother's father died in the 1919 pandemic.
Wow.
And left, his wife was pregnant with 5 kids. So, and there was no way of, and so it's learning from those events that I keep saying these are not completely unprecedented. We just haven't had them all happen at once before. Right?
Yeah, for sure.
But I keep saying there are all the tools we actually need if we just change direction. We can spend the money to make people safe. We can spend the money to make sure that people can pay their bills. This is it's not rocket science. It really is just a question of political will, and there are ways of fixing it. So I mean, I'm optimistic in the sense that there is a way. There is absolutely a way through this, and it doesn't have to be as horrible as everyone fears.
I feel the same way, and frankly, it shouldn't be a partisan issue, even though that seems to be what it is. But I feel the same way. I think it's important to look forward, give people hope. Let's keep moving forward, even though we're in the dark days right now. Yep. Sooner or later, it will end. We just need to follow what we can follow, and frankly, make sure people can live. Make sure people can pay your bills. Go outside, work on your mental health, have supports, which I feel like that's what's missing. But that said,
well, and I think the one thing it is it becomes a partisan issue, but it's just I've realized it's partly just because political parties have different. It's not just for partisan advantage, but I mean, it's also that we just have different worldviews, right? It's that I have a very different, I think it really is just a question of people's opinions about the way the economy should work. Mm-hmm. So Brian Pallister has a very specific idea of this is the way. Well, and look, he's coming from a system. Like he's coming from a bunch of people who've said, well, if you do this, then bad things will happen. And I'm taking it from people who have a different view. Said, no, it won't. That bad thing won't happen. Like, we shouldn't be worried about. We shouldn't be worried about that. Worried about the bottom line right now, because the most important thing is like if we the more businesses we can save, the less we'll have to worry about the bottom line later on, because they'll all be around to pay taxes and
exactly
right. That's
exactly.
Yeah, I feel the same way. I've made that point on a previous episode where nobody cares about the deficit right now, nor nobody should, but that is what it is. Anyway, not to steal too much of your afternoon, we'll dial it down. Thank you again for joining us, Dougal. I'm glad that we're able to get multiple perspectives, and particularly yours with your history. I don't know if there's anything else you want to touch on real quick before we let you go.
Well, there is actually, because I was talking with a friend of mine in Steinbach, and I was shooting my mouth off, being critical of people who wouldn't wear masks back in April, right? And he said, you were right, but you were the wrong messenger, right? So this is it also goes to the partisanship and trust. Like, it's one thing if I'm the one who's saying it. It's very important for people who are conservatives to say that as well. The other is just I read an interesting thing about how people respond to talking about these things. So, and apparently it was the idea that the people who are more skeptical, it's because it's invisible, right? So it doesn't seem like it's real. So but part of it is talking about it in a way that gives this, like, to realize, look, the virus actually is a living thing. It's a living thing, and it takes you over, and then it uses you to spread it, right? And that it really does do that. It's like a zombie virus, like to think about it in those kind of horrific terms, but to understand, but that actually helps. If it helps people understand the way that the infection spreads, like it really is this thing. That it is, that people have called it insidious, or they try to turn it into a person. But that's an important thing, is that, look, different people learn different ways, different arguments convince different people. But that's it, is that, a year ago, this virus was not in Manitoba, and we can drive it out again. That's part of the way I was thinking. The way
for sure.
So it is, and the one other thing people have been talking about a lot about vaccines. We have to focus on what we need to focus on now. The vaccine is promising, but we have to focus on staying safe and making sure people get paid and all those other things right now. That's because the virus isn't going to be, the vaccine isn't going to be here for 3 or 4 months. Minimum.
For sure. Oh yeah, if it reaches us even close to that time. But regardless, thank you again, Dougal. It's always great to get your perspective. And
thank you.
Yeah, stay safe.
You
stay
too.
safe
all
out
the
there.
best.
You
yeah,
too.
you too. Take care.
Thanks. Yeah.
Bye.
All right, folks. We are back in the studio remotely, as we've been doing recently. And we hope that you enjoyed what you've listened to. We hope you learned something. Hopefully you got something out of this, is sort of the gist.
Right, yeah. Basically, we wanted to bring you as many different perspectives as we could on the pandemic and what's going on. And again, just to shine a light on the people that may not have the light shone on them or don't have the opportunity to talk about these things.
Yeah.
And just give you that first person sort of perspective.
Yeah, and I think it's fair to say that a lot of people that we reached out to were worried about speaking at all. So that's why we have some anonymous folks join us, because there is pressure from the powers that be that they shouldn't speak publicly about such things.
Yes.
Which I don't necessarily agree with, but I guess I get it on some level to avoid whatever, hysteria, blah, 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 blah.
For sure. Well, we don't want people losing their jobs on behalf of us. So.
100%. That said, thank you to everybody that did join us publicly and anonymously. We hope that if you're listening, that if you find anything valuable in this episode, that you share it. We would love to get as many ears and eyeballs and voices attached to this as possible. So, please do that.
Yeah, just help us get the message out. We care about all these people, and we want to help in any small way we can.
Exactly. And before we go, on a lighter note, this episode is sponsored by Manscaped. You thought you were going to get away with it, folks, didn't you? That before but nope. No. So, the two idiots are supported by Manscaped, who is the best in men's below-the-belt grooming. Manscaped offers precision... Oh, we're going to overtalk.
Rad, we're going to overdo it here.
Manscaped offers precision-engineered tools for your family jewels.
So, it's jingle balls to the walls, fellas. Okay? It's almost Christmas time. We need you to listen up.
Yeah.
Untrimmed pubes are a thing of the past. Yeah, I said pubes. What of it? Now, it's time to gear up. Get yourself a gift of shaving this holiday season. And I am talking about the Manscaped Perfect Package 3.0.
3.0. Yeah, that thing is the bomb. And we've all dealt with ones that are not good. You're getting ready for a Christmas gathering. You want to feel your best, feel confident. So you get down there and you start trim the wreath a little bit per se, and things go a little bit sideways. And sometimes mistakes happen, or inferior products happen, and you hurt yourself. So
we've been there. We know the pain of a nick and a cut and a pull and a pinch.
Yep.
And it's not good.
Nope.
It's not good.
It is not. That's why this revolutionary company, Manscaped, has redesigned the electric trimmer. Their Lawnmower 3.0 has proprietary advanced skin-safe technology, so this trimmer cuts on your nuts. It's also waterproof, so you can use it in the shower. Easy peasy.
Look at that. Yeah, easy cleanup. The cleanup doesn't get easier. Give it a shave, you wash that shit away.
Yep.
Now, Reg, the Lawnmower 3.0 comes inside the brand new Perfect Package 3.0, which makes for the perfect gift this holiday season. It is literally everything you need to keep trimmed, cut-free, and smelling nice down there.
That's true. And don't use the same trimmer on your face as you're using on your balls. That's just nasty.
Yeah. Yuck.
Yeah.
Reg, I gotta let you know that the Manscaped Perfect Package 3.0 also includes crop preserver, an anti-chafing ball deodorant, and moisturizer. You already put deodorant on your armpits. Why are you not putting deodorant on the smelliest parts of your body? Yeah, your balls stink. Okay, put some shit on there. Put some of the the crop preserver onto your crop.
Yeah, you should. I've used the deodorant. It smells pleasant. It works. I don't know. It's nice.
From a man who suffers from the chub rub, I tell you, you can take it from me. This is some of the best anti-chafing stuff I've ever used.
That's amazing. Also, so they smell good. Their manly scent is attractive, and they'll help you set the mood, if you know what I mean. You know, have a little Christmas baby, maybe.
Ooh.
I don't know. The perfect package will also come with a pair of Manscaped boxers that'll keep your junk feeling fresh all day. It's time to upgrade over those used pair of boxers to Manscaped. We each have a pair. They're quite nice.
I'm wearing them right now.
Oh,
I'm all branded up today, as you can see here.
Yeah. Randy's rocking the Manscaped TM everywhere.
So it is the season to Manscape. So go get yourself, your dad, your brother, your friends, the best gift of all, the Manscaped Perfect Package 3.0.
That's right. Get 20% off and free shipping with the code IDIOTS at manscaped.com. Your balls will thank you.
They will. It's going to be good. Now, once again, just to reiterate, because we know you guys don't hear it enough, get 20% off and free shipping with the code IDIOTS at manscaped.com. That's 20% off with free shipping at manscaped.com using the code IDIOTS. Clean up your nuts and make Santa proud this year.
Yeah, I'm pretty sure Santa is very concerned about my testicles. So,
what you do is you put a little picture for him just so he knows you're clean by his milk and cookies, and you're good to go.
Yeah, he'll never leave. Anyway,
you're gonna show Santa your lumps of coal.
No. Anyway, also, folks, before we let you go, please check out our Patreon. If you would like to donate to the show. We understand COVID has made things difficult, and we don't expect anything, but if you feel the urge, we have a few tiers as low as $3 a month. You won't even notice. You can support the show, get extra episodes, get entered into some merch stuff. Yeah, we'd love for you to join the community.
For sure, yeah. It's all going to help us go towards bettering equipment, making the show better for you guys. Like you said, bonus content, merchandise draws. There's even a level where you can get a dinner and a game with us.
Yep, we'll take you.
Who wouldn't want to go out with these two fine mugs?
No kidding. I mean, my wife, but that doesn't count. But folks, if you feel like donating and contributing, please do. Find us on Instagram at 2 Idiots Podcast, on Facebook 2 Idiots Podcast, on Twitter 2 Idiots Show, and on YouTube. Just search for the 2 Idiots Podcast. There's a few there. Just look for our logo. We're that one. We're the best one.
You'll find us.
Yeah.
And by email, doubleidiotspodcast@gmail.com. Send us your comments, your guest ideas. If you want to be a guest, let us know. We're open 24/7 here at the 2 Idiots Podcast.
Yeah.
And we want to know how you feel. And again, if you so inclined, patreon.com/2 Idiots Podcast.
Boom shakalaka. We've had several interesting people reach out to us, so we've got some fun ones coming down the pike. So, yeah, thank you for listening, folks. Hope you enjoy your day. Stay safe out there. Follow the rules. We love you.
Wear your mask. Adios.
Bye.